Procedure and House Affairs. I'd like to start the meeting by providing you with some information following the motion that was adopted in the House on Wednesday, September 23rd, 2020. The committee is now sitting in hybrid format, meaning that members can participate either in person or by video conference. Witnesses must appear by video conference. All members, regardless of their method of participation, will be counted for the purposes of quorum. The committee's use of House resources, which is determined by the whip. All questions must be decided by recorded vote unless the committee disposes of them with the unanimous consent or on division. And finally, the committee may deliberate in camera, provided that it takes into account the potential risks to confidentiality inherent in such deliberations with remote participants. Today's proceedings will be made available via the House of Commons website. A reminder that the webcast will always show the person speaking rather than the entirety of the committee. To ensure an orderly meeting, I would like to outline a few rules. For those participating virtually, which is everyone today, basically, members and witnesses may speak in the official language of their choice. Interpretation services are available for this meeting. You have the choice at the bottom of your screen of either floor, English, or French. Before speaking, click on the microphone icon to activate your own mic. When you are done speaking, please put the mic on mute to minimize any interference. Reminder that all comments by members and witnesses should be addressed through the chair. Should members need to request the floor outside of their designated time for questions, they should activate their mic and state that they have a point of order. If a member wishes to intervene on a point of order that has been raised by another member, please use the raised hand function at the bottom of your screen. When speaking, please speak slowly and clearly. Unless there are exceptional circumstances, the use of a headset with a boom mic is mandatory. Should any technical challenges arise, please advise the chair. Please note that we may need to suspend for a few minutes to ensure that all members are able to participate fully. With that, we will begin with the first panel. We have here with us today, we have 3 panels today, and it's a 3-hour-long meeting today. We will be going until 2 o'clock. Ideally, I'll be trying to end the panel 5 minutes before the hour so that we have time to transition into the next panel, and we'll try to be as efficient with time as possible. So for our first panel, I'd like to welcome
Point of order, just before we get started. Sorry about that.
Mm-hmm.
I just wanted to bring forward, we had talked the other day, and perhaps you can give clarification. We had talked about time frames and timelines and looking at when we're going to start the next studies. I was just wondering, I didn't see that in the notes or any business opportunities for these today for these 3 panels, but when are we going to be able to have that discussion on the next study?
Yeah, it's not possible in today's meeting, that's for sure, because we have 3 panels and have extended the hours already for this meeting. But we are looking, there are upcoming meetings, and I can discuss it at the end. We have a meeting on a November 17th with Minister LeBlanc on the main estimates. And then we have a meeting on November 19th with Elections Canada on the main estimates. And then we have a meeting on November 24th. Those are the next 3 meetings. And that one is with the Speaker and the House Administration, including PPS. So all of those meetings have to get done because we have a deadline for the main estimates. But I did say in the last meeting that I will squeeze in committee time before the winter break so that we can plan out our next study, slot in, have a discussion as to how long we would want that study to be on prorogation, what witnesses we might want. So I'm working with Justin Dave, the clerk, to fit in a committee business portion where we have half an hour or more to discuss that.
Okay, excellent. And I will be following that up because I do think we need to have it, the study should be starting prior to the Christmas break. So hopefully we will have a meeting before so that this is actually going, I would hope that it's not held off to the mid of December. So thank you very much.
The I'm sorry, Ms. Vecchio, did you say that study should start prior to the winter break?
Well, we would hope that we already have something already sorted out with plans before the winter break. So
Yes.
I just, if we can make sure that we have this all planned, but I would hope that we would not be seeing a meeting the second week of December to discuss this committee business, and that we actually do it much earlier than that. That's all.
Okay.
Thank you.
Okay, so we would discuss the committee business and the study before the winter break, but we wouldn't be able to begin the actual study before the winter break.
Well, perhaps we can look at what options are available. That'd be awesome, and we can go on with today's panels. I just want to plant that seed. Thank you.
Okay, thank you, Ms. Vecchio. All right, so I'd like to continue by welcoming our two witnesses that we have today, Jason Lee from Canadian Association for Long-Term Care, and Donna Duncan from the Ontario Long-Term Care Association, and she is the Chief Executive Officer. So welcome to both of you. Thank you for being with us today. And we will start with opening remarks by the two of you, and you have 5 minutes each for your opening remarks, and that will be followed by rounds of questions by all of the members. And it should take us to 11:55 or close to 12 o'clock. So if Mr. Lee, if you could start, please.
Thank you, Madam Chair. And I want to thank the members of the committee for inviting me and Caltech to appear before you today. We're here to discuss seniors living in long-term care and the support needed to ensure residents can participate fully in our democratic process during the COVID-19 pandemic. Again, my name is Jason Lee, and I'm here today as the treasurer of the Canadian Association for Long-Term Care, also known as Caltech. As the leading voice for quality long-term care in Canada, Caltech members advocate on behalf of our residents at the federal level to ensure seniors can age and live with dignity. I would like to take a moment to acknowledge that yesterday was Remembrance Day, and that this conversation aimed to ensure an accessible, safe voting for our seniors, the seniors who built this nation, could not be more appropriate or important. During a federal election, Elections Canada has the responsibility to ensure that all eligible voters are able to exercise the right to vote, and it is our collective responsibility to accommodate them to do so. Many of the normal voting procedures used to assist residents in long-term care have significant health risks in the context of the ongoing COVID-19 pandemic, some of which I will outline. Outside visitors to long-term care homes must continue to be restricted to essential caregivers and workers for the continued health and safety of residents and staff. While election workers could fall into the category of essential workers, it is not safe at this time to have an election worker go into a home and facilitate a mobile voting station and then move from home to home. This is especially true as we continue to see more homes go into outbreak or suspected outbreak across the country. Additionally, any procedures in place that support seniors in leaving their long-term care homes to go to a polling station are simply not feasible as COVID-19 continues to increase rapidly in communities across the nation. Any staff member who might normally assist seniors in going to a voting station are not just hindered by the risk of transmission, but by the increased staffing pressures in care homes as they continue to carry out new and ongoing infection prevention and control measures on a daily basis. There is simply not enough staff or personal protective equipment to ensure a safe trip outside a home to vote or to have an election worker enter multiple homes. In our homes, or my home province of Prince Edward Island, we normally use our long-term care homes as polling stations. I've already been in contact with the elections officials for the riding where some of our homes are located, and it has been communicated to me that the polling stations will be moved to other sites. This is completely understandable and necessary, but it also further isolates our seniors from the community. Where our seniors would normally be able to walk down to the lobby and vote with others from their riding, they will not be able to do so in the current environment. However, we must not let this virus interfere with seniors having their voices heard or ensuring seniors living in long-term care are appropriately engaged in the voting process. As you know, 3 provinces have been through provincial elections during the COVID-19 outbreak, including New Brunswick. There are some lessons learned and considerations that I would like to share with you today, and they may help inform the committee and Elections Canada in addressing the challenges and circumstances of the current moment. In New Brunswick, an alternative voting method was put in place that included the returning officer sending a letter to long-term care homes that outlined the instructions for a modified mail-in vote by mail process. This was a time-consuming process that required 2 weeks to coordinate and carry out the actual voting, along with many weeks of consultation beforehand. In this instance, administrators or other staff in the homes were deputized and trained to collect and return the mail-in ballots. Any process put in place for a federal election will need to be cognizant of the time frame, effort, and resources needed to assist residents in voting. In closing, with staff not being able to accompany residents outside the home to vote given COVID-19, the dangers of having a mobile election worker going from home to home, and the inability to hold voting stations in long-term care homes means that seniors living in long-term care will be very disconnected from this process, and homes will require support and guidance to ensure that they can appropriately engage residents in the democratic process. Thank you for your time, and obviously I'm happy to answer any questions.
Thank you, Mr. Lee. We appreciate your statement. Next, we've got Ms. Duncan, please.
Thank you very much, Madam Chair and committee members. It's a privilege to be here with you today, and per Mr. Lee's comments on the day following Veterans Day, when we recognize so many of our residents. We are grateful to the committee for recognizing the importance of ensuring that voting privileges are available to residents of Canada's long-term care homes during this pandemic. To set the context for today's discussion, I'd like to provide an overview of Ontario's long-term care homes. More than 79,000 people live in long-term care in Ontario in 626 homes, with more than half of our residents being over the age of 85. Approximately 1 in 6 of our residents is younger than 75. In Ontario, we have stringent criteria for admission into long-term care. Most people are not eligible until they are experiencing significant impairment due to physical frailty and or cognitive impairment. 90% of residents have some degree of cognitive impairment ranging from mild to severe, caused by conditions such as dementia or stroke. In prior elections, it has been common practice to establish polling booths in the lobbies or other common areas of long-term care homes to enable the resident population to vote, as well as the neighboring community members. This is not possible during COVID-19 due to Ontario restrictions around access to long-term care homes and the extreme vulnerability of our residents to outbreaks in COVID-19. In most cases, as per Mr. Lee's comments, escorting residents from long-term care homes to voting booths elsewhere is also not possible due to a number of differing factors. First, under our provincial directives and now evolving regional directives, non-medical absences from the home are not possible at all during an outbreak or in a region that is considered at high risk or a hot zone for community transmission. As of November 10th, 15% of Ontario's homes are in COVID outbreak. Several major urban areas remain areas of higher risk, and outings are not permitted. Second, if neither of those factors are in place, non-medical absences need to be approved by the home based on a case-by-case risk assessment, and recognizing the risk to our residents is extremely, extremely high, and we do not recommend absences. Third, if an outing is improved, most homes do not have the staffing capacity or support to take residents out of the home to vote. While some residents may have families that can assist, many residents do not have these supports readily available and would be reliant on staff for transportation to the voting site. Our long-term care homes are experiencing a critical staffing shortage, which predated COVID-19 and has only been exacerbated by the pandemic. And this has implications for staffing capacity to support resident voting either in the home or outside of the home. Despite the challenges of COVID, it is vitally important to ensure that voting privileges are available to residents of long-term care. Mail-in ballots may be the simplest option for residents to manage and staff to facilitate. Per Mr. Lee's comments, we're certainly open to discussions of processes that could facilitate that. There may be other options that the committee is considering, including electronic voting in the homes, and we'd be pleased to bring that back to our members for review and feedback to support successful implementation. We are committed to helping our residents exercise the right to vote. And again, we'd really like to thank you for recognizing the importance of this issue and exploring solutions during the pandemic. Thank you.
Thank you, Ms. Duncan. We'll start with our first round of questions with Ms. Gladue. It's an honor to have you on the committee today, substituting in. It's
care facilities. And so, you know, when I look at the reports, I'm the chair of the Status of Women Committee, and we've just had testimony on long-term care facilities and how understaffed they are. And you know, the federal government really, in my view, has abdicated their responsibility to come alongside and help. And I worry that, you know, if the Liberals are forcing an election in a pandemic, that this is going to exacerbate an already concerning situation. So the points that you've made about protecting the people that are in the long-term care facilities, as well as the workers, I think is important. One of the concerns that I have is trying to make sure that there isn't undue influence. So my mother just recently passed away, and she was in long-term care, and she's as sharp as a knife normally, but she did have her days when she was, you know, mentally confused or whatever. And so I'm interested in any suggestions that you have on how we could make sure that, you know, someone that is deputized is not voting their personal preference through those that are maybe not able to decide.
I guess I'll start. You know, I think it's a great question, especially as we look at how so many of our residents do suffer from advanced dementia and cognitive impairment. Certainly, training is very important. Working through Elections Canada to establish parameters in training, ensuring neutrality as we support our residents. How we work with substitute decision makers as well will be very important for us. Certainly, the right to vote is paramount, but certainly appreciate your comments around the potential for coercion or influence. I certainly welcome Mr. Lee's comments because I know he's been speaking to his Eastern Canada colleagues around this as well.
Thank you, and it is it's a good question, and it's actually a question that or a topic that comes up I think every election, not just around a pandemic. You know, if a person is unable to physically mark their ballot, you know, they can receive assistance to mark their ballot. You know, there is a process where the person has to, you know, solemnly declare that they will mark their ballot in the manner they're directed. It's a very serious oath and commitment to make, and you know, we expect people to honor a commitment or an oath like that, and we want every Canadian who wishes to vote to be able to vote. And I know, having seen elections take place in our homes, you know, firsthand, it's something that the staff are, you know, they take a lot of time to get trained and understand the very complex and thick Elections Canada Act, and I think they do an excellent job of making sure people vote, and the exceptions are hopefully very, very few.
Good. And Mr. Lee, to your point, you know, we talked about the amount of time it would take to train somebody to be deputized. So one of my ideas was if we had rapid testing for the Elections Canada people that could get their rapid test and be negative before they entered, and then not have them go to different homes, right? Have different ones assigned for each one. Do you think this is a feasible option?
You know, to do that in one home, absolutely. You know, to have your team aware of where they're going to be working and why it's so important that they be healthy, so that you know, the testing is certainly a part of the solution here. Of course, you know, in a federal election, you're looking at such a massive scale. I'm not aware of rapid testing even being in place here in Prince Edward Island. It may be more common in other parts of the country, but yeah, I don't see why it can't be part of the conversation or the solution.
No, you're right. The rapid testing really is not where it needs to be. One other question. So normally in an election, the candidates get to go into the long-term care facilities and they get to hand out their brochures and leave them all over the place so everyone will vote for us. Now, I can't see that happening in a COVID-19 situation. So do you have recommendations about how the residents will be able to be informed about the issues and the candidates in the campaign? Ms. Duncan.
Certainly communications has been key, and as we've been navigating this COVID-19 environment, certainly in Ontario, we've been taking advantage of the benefit of our residents' councils, and our homes and frontline staff have been working very closely with residents' council to ensure share the information, even today, around changing directives, infection outbreaks, communicating around visits. Working with the family councils as well, and ensuring that everybody is well educated. We have been sharing information from our local representatives through those councils as well, and making sure that every home is meeting the test of communication, and how information is posted and shared in each home has been certainly a challenge early on in wave one, I have to confess, as we tried to navigate that. But we do have far better processes now, I would argue, including in how we use technology to communicate with our frontline, through our frontline and our volunteers with our residents.
Thank you, Ms. Duncan. Next up for 6 minutes, we've got Dr. Duncan, please.
Thank you, Madam Chair, and thank you to our witnesses this morning. And I'd just like to begin by saying thank you for providing care during a pandemic and how difficult that is. And I'm deeply concerned about the impact of COVID-19 on long-term care, and doing everything possible to protect resident and staff health and safety while ensuring residents' right to vote. Ms. Duncan, if I could begin with you, I have limited time, so in many cases I'll be asking for a number or a yes or no, please. How many Ontario long-term care homes are currently in outbreak?
We have 94 in outbreak right now.
Thank you. How many COVID cases at this time, staff COVID cases, please?
Currently, we have 435 staff cases.
Thank you. How many resident COVID cases, please?
We have 695 resident cases today.
When did COVID cases start to increase? When did you start to see, have you started to see deaths going up in long-term care in the second wave in Ontario?
Since September 14th, we have now experienced 200 deaths in long-term care. So the date would be September 14th.
Thank you, Ms. Duncan. I'm so sorry to hear this. With hundreds of staff cases, do you have staffing shortages? I'll start by asking a yes or no question.
Yes.
What is the percentage staffing shortage you have in Ontario, please?
The Ministry of Long-Term Care estimated in the summer that we would need to replace 6,000 just PSWs, and we have critical shortages of RPNs and RNs as well.
Could you table with the committee the shortages across the various care groups, please?
Yes, take two.
Thank you so much. Has Ontario put in place a staffing recruitment scheme? And if so, what is the number, what's the target for the province to hire and by what date, please?
The province has released a staffing strategy or a staffing review study in the summertime. We anticipate a staffing strategy will be tabled at the beginning of December. So it is still very much work in progress. However, they have the province of Ontario has launched a number of initiatives, return to service program for PSWs, which they hope to attract 2,000 PSWs. This past week, they've announced.
Could I stop you there for a second, Ms. Duncan? You
Yes.
said 2,000 by what date, please?
It was an application process where the application deadline was in October, with the intent that the individuals would be in place in November, December of this year.
Are you seeing those numbers in place?
No, we are not.
Thank you. I'm very sorry to hear how difficult this is. If I could go to Mr. Lee, please. How many long-term, could you table with the committee, how many care homes are in outbreak across all provinces, please? I'm looking for a yes or a no.
I will get that information and table it with the committee.
Thank you so much. Could you table how many staff COVID cases at this time across all provinces, please?
Again, I'll do my best to gather and table that information.
Thank you. And resident cases as well, please.
Again, we will work to gather the information and table it.
Sadly, can you also do that for deaths? And since Ms. Duncan mentioned September 14th, I'll use that date, please.
We will.
I believe that Quebec committed to hiring 8,000 people by mid-September. Can you tell me if that happened, please? Yes or no?
I can't answer yes or no to that question. I'm not aware.
Would you be able to table with the committee how many people have actually been hired in Quebec, please? Is there a way to find that out?
Our organization may not have access to that information, so I will promise to provide it if we can.
Thank you. I believe BC government announced that it would train up to 7,000 people to work as healthcare aides in long-term homes, and I would have the same question if you could look to provide that information, please. I will ask you, Mr. Lee, what is the current what outreach has been done by Elections Canada to you? Have you had meetings about how to have elections in long-term care?
We have had discussions with the local returning officer for the riding of Charlottetown.
Could you table with the committee what meetings, the dates of those meetings with Elections Canada, not for the local riding, but with your organization, please?
Oh, I understand. I will seek that information and table it.
Thank you so much. I'm out of time.
Thank you, Ms. Duncan.
Thank you both.
Monsieur Thérien, 6 minutes.
So hello everyone. A question. Hello. I don't know who's going to answer. It could be either one of you. Do you hear me? Yes. Yes. So I think, and tell me if I'm wrong, I think that in Quebec, if somebody doesn't have the capacity to vote, are they removed from the electoral list? Is that how it works elsewhere?
Investigate further, but it's my understanding that names are not removed from the federal voters list for that reason. But we would have to confer with Elections Canada and the Act, and again get back to you with an answer.
Well, listen, I had asked this question to somebody who had been here previously. So I was told that no, but I wanted to know if this is something that would be possible. I think that if, for example, my mother is in a long-term care and that she doesn't have the capacity to vote, I cannot ask to have her name removed from the voters list. So I think that this could be a problem in certain situations, and it could lead to fraud for two reasons. I would say you can't take somebody off the voters list. The fact that those who are doing the personal and electoral work because of the pandemic, and also there may be more mail-in votes. So with the little knowledge I have, I do believe that there would be an increase in potential fraud. What do you think?
A great question, and an important question and a concern. And how do we make sure that we're balancing the rights of the individual, because our residents still are individuals with rights and legal rights under the legislation. Similar to Mr. Lee's comments, it's something that we would welcome an undertaking on to have clarity on, to ensure that we're ensuring the integrity of the voting process while also recognizing the rights of our residents.
So there, you're talking about training for people who are involved in the electoral process. You're talking about training with the workers who are working in the long care homes. Is it those people that you will offer training to? Is that what I understood? Have I understood you?
The training in my mind here, the training is provided through Elections Canada, and they would work with the individual homes to identify who the election officers and who will be deputized, or whatever term they want to use would be. It could be people actually coming in from outside the home who have been cleared to enter the home. Or it could be staff who would be trained. But the training itself, I would be looking to Elections Canada to provide that training.
Do you think that in the training there is an idea that if you see that a person is not capable of voting because they have cognitive issues, intense cognitive issues, dementia, do you think that that is something that will be part of the training?
Yes, I believe it would be. The individual would have to be able to clearly identify their preference. They may have cognitive impairments, they may have physical impairments, but if they can clearly articulate their choice, it would be the duty of the elections officer to ensure that their vote is cast to their wishes and to nobody else's.
Okay.
So you understand that I have a lot of concern with respect to fraud, and the lot is occurring. It's already exists in such a type of situation, and I think that it could increase during a pandemic, and it's not your fault. It's simply because of the pandemic, the situation, that it could increase the fraud. And so I think that I'm running out of time, but my last question. You're saying that it's impossible to have people come out of their homes to be able to vote elsewhere. So there could be voting stations outside of the homes, and that they would be able to go out and vote as was the case before the pandemic.
Seconds, if you can, quickly.
Well, I would never want to say anything is impossible, but clearly to mobilize across the country to be able to have people leave long-term care to go to external polling stations would be a tremendous drain and strain on the staffing and personal protective equipment supplies. So it's possible, but difficult.
Thank you. Mr. Blakey for 6 minutes.
Thank you very much, and thank you to our witnesses for joining us today. We've heard from a number of elections officials and a number of public health officials who have said that they're confident that they can deliver an election in a way that is safe in principle. That is, if everybody follows the appropriate procedures, nobody should have anything to worry about in terms of, causing a COVID outbreak as a result of a vote. But what they've been kind of reticent to comment on is the possibility that, and they haven't really tried to quantify the extent to which we might see people, because of a level of discomfort with voting, simply choose not to vote, and the disenfranchisement that might occur simply because people, for all of the proper precautions that have been taken by public health officials and elections officials, just simply don't have that comfort level. In terms of your membership, do you think that there is a real risk of many people in long-term care or many seniors more widely, for that matter, who are just simply too worried about the potential health consequences of voting, whether it's voting in a personal care home with outside staff that are coming in for that purpose, or leaving their home to vote, and not sure that they can navigate the application and implementation of a mail-in option? Do you think there is a real risk of seniors and people living in long-term care being disenfranchised if we hold an election during the pandemic?
I'll start on this one. Certainly, historically, Elections Canada would set up the polling stations in our long-term care homes. If we look at the capacity, the physical capacity of so many of our residents, and in Ontario, it's 79,000 residents, to be able to go outside to vote. Certainly, that would take a lot of resources, both staffing resources, family resources, as well as personal protective equipment. But also what we have seen in our long-term care homes among our families, our residents, and our staff is a much diminished mental health capacity and resilience. There's a lot of fear, a tremendous fear, certainly in our homes in Ontario, fear and anxiety among our residents and their family members. We've certainly heard it from our family councils. So having some mechanism to vote within the home is ideal. Certainly, we did hear from some of our members in Toronto, where we had by-elections earlier this fall. There was a certain reticence of people going outside and wanting to contain all activities in the home. But again, having more people come into the home only creates fear when you're in a hot spot. We know the tension even in having family visitors. We know it comes in from the outside. We're open for visitors now. We have far more foot traffic, and the risks are far greater.
Thank you, Ms. Duncan. Mr. Lee?
Yeah, I think I would just add that I think Donna is quite right that people are very cautious, and it's incumbent on all of us here to make it as easy and transparent as possible for people to vote in their homes. That's mostly what people are used to in long-term care. They don't go to other locations to vote in most cases. They get to do it from the comfort of their home. and we need to find ways to do that are safe and allow them to be fully engaged. Because your question is a good one, and it should be on everyone's top of everyone's mind.
So this is a question, if you don't mind, maybe just get a brief answer to. We've heard from the Chief Elections Officer that the federal writ period can be between 37 to 51 days. He's of the view that it should be longer. In your opinion, do you think a longer writ period would have a salutary effect on voter turnout within long-term care facilities and the senior population generally?
We certainly, as an association, would advocate for a shorter period. Just given the demands on staff, the more condensed the process can be, the more defined it can be, the more contained it can be. Certainly, we think that the easier it can be, the better. So certainly, we would prefer something not overly prolonged, just given the demands on staff time around communication and support and education in the homes, recognizing there may be more time up front required to put mechanisms in place.
Yeah, I would echo that, and I think we're less concerned about the duration of the actual election campaign as we are concerned about what we're doing here now is the pre-planning to make sure that we've thought of all the scenarios and that we have a plan in place and hopefully communicated clearly in advance from Elections Canada across the country. If that's the case, then we could probably manage an election campaign of any of those durations.
And when we talk about training for people to be able to assist people in care homes, I think we've heard that often that's done by returning officers and returning offices once they're set up within the election window. Do you think it would be good for Elections Canada to begin offering training even in advance of writ drop, so that there are some people within long-term care facilities who have training to be able to assist when the writ drops, as opposed to trying to do it all within the election window?
Yes.
Yes, I would agree. And speaking to our local returning officer, he was commenting on how it seems to be getting more difficult to actually find people to work during elections in polling stations. So if that's been a challenge for them in the past, I expect it will continue to be a trend and a challenge. And in the middle of a pandemic, it may be exacerbated and be even harder. So maybe getting to work on getting their workers lined up and maybe trained as well, as you say.
Thank you. Ms. Vecchio, 5 minutes, please.
Thank you very much. And today's conversation is going extremely well. We're hearing from a lot of different information, starting off with Dr. Duncan, looking at some of the information she's looking for, and then specifically on the issues that Daniel is bringing up. When we're looking at some of the easiest ways to make sure that we are not disenfranchising the voters, but keeping the safety of the long-term health care facilities, starting with Donna, what would some of the most positive things that you could see that Elections Canada would do that would be able to have people vote at the safety of all? What are some of the suggestions you have?
Certainly keeping voting in the home, whether that be through mail-in vote or using technology, and certainly through the pandemic, technology enhanced engagement of our residents has certainly escalated exponentially. Ensuring that public health is very much involved in working in partnership. I think Mr. Lee did mention the stress and strain on personal protective equipment. We know certainly in Ontario, homes in outbreak would have access to N95 respirators, which we know are not easy to come by and very difficult to use, and could increase infection spread. Certainly the training, ensuring that anyone going into the home has that infection prevention and control education themselves, so as not to put a greater burden on the staff and the volunteers who would be supporting the process in the homes. Thinking about the layout of the homes, so and again, how we do this so as to avoid contamination is going to be really, really important, and the sensitivity is important. And I would say that it's important that anyone supporting this process have empathy.
Excellent. Yeah, no, perfect. And Jason, I'll move on to you very, very shortly here as well, because as you indicated, we have the staffing challenges. I know I was speaking to a long-term care facility in our area, and because of the changes and being able to work at only one place, they lost 30% of their employment from some of these homes. So we have that issue. And as you indicated as well, trying to find people that are going to be working in these elections. The statistics that are showing is that the majority of people that are working as poll workers are our seniors themselves, and many of them, may not have that, may be vulnerable to this disease as well. Also, talking on what you said, I just saw that the cost of a box of gloves for vinyl gloves has gone from $16 a box up to $96 a box. That is what the County of Elgin is now having to pay. So I think those are huge concerns as well. One thing that we've talked about is because of the shortage of workers and because of the concerns about the rapid testing. And I know that Marilyn Gladue talked about that currently, and I'll start with Jason. What are the protocols to be able to enter into one of your homes at this time? And do you use rapid testing? Do they need to show negative results? What are your requirements at this time?
Well, I'm located here in Prince Edward Island, and we're probably not the best jurisdiction to use as the example, because we've been very fortunate with COVID-19 to be very limited in the amount of cases we've had. We've had no cases in long-term care homes. We currently have, I think, 3 cases across the province. So we're very fortunate. And as a result, our restrictions to the homes have been probably reduced to the lowest level that you're going to find in the country. Right now, each of our residents is allowed to have basically 3 partners in care, which would be close family and friends who can more or less come and go from the building as they please. And in addition to that, they can visit with people at a safe distance, 6 feet or more, wearing personal protective equipment through sort of a scheduled visiting schedule. And so the access here in PEI has really not gone back to the way it was, but we've been very fortunate, and probably not the norm across the country for sure.
Donna, I only have a few seconds. Can you add your thoughts on that?
Yes, we have 2 essential visitors who do an attestation, not testing. Only staff are being tested every 2 weeks, and residents when they become symptomatic. And essential visitors have to schedule visits, and there's only 1 essential visitor permitted at a time.
Okay. Thank you, Ms. Duncan. Mr. Garrettson, 5 minutes.
Thank you, Madam Chair. Ms. Duncan, I guess I'll start with you, and picking up on the conversation that you were having with Ms. Vecchio. You said that the ideal scenario would be to have voting mechanisms that were occurring inside the home. We've discussed a little bit about the challenges with having polling locations set up inside a home. So and I know in your opening comments, you said that mail-in ballots may be the simplest option for residents to manage and for staff to facilitate. Can you think of a mechanism that might be simpler than that, or would you say that would be your preferred choice?
It's a great question, and perhaps sometimes the oldest formats are the easiest formats. And if you could pursue it as an advanced ballot, or an advanced polling process, rather than having it exactly on voting day, that might be preferable to work things out ahead of time. Certainly, if there's some sort of online tool or mechanism that could be overseen and incorporated into the home, recognizing that all communities have access to broadband, but certainly our residents and our family members and our volunteers and staff and others have been using technology.
What about, we've talked a lot about the safety of the residents, but what about the safety of the employees and what they have to be involved in to help to facilitate the voting, whether it is escorting residents to various different locations.
Mhm.
Do you believe that a mail-in option would also be the safest from the employee perspective?
I believe it would be easiest. It would reduce the amount of contact that an employee would have with other people. Certainly with the residents, they work in supporting the residents on a daily basis. They're accustomed to screening visitors. That has now been built into the role description. But the less contact is better, and the less foot traffic within the home, certainly in an outbreak situation, is ideal.
So I just want to change gears for a second. There's been some discussion over the last hour here and there about fraud and the possibility of fraudulent activities. For starters, neither you or Mr. Lee have studied this or looked into this, right? So any information that you're giving is anecdotal at best. Is that fair from both of you, Ms. Duncan?
That's fair.
And Mr. Lee?
Yes, that's accurate.
So my question to my follow-on question to that is, given the vulnerability of many seniors, notwithstanding the pandemic, that potential for fraud or people not voting or assisting to vote in a way that doesn't properly reflect the individual, that can be something that happens already, correct? Like, I mean, doesn't require a pandemic for that to occur. Would that be right, Ms. Duncan?
And per Mr. Lee's earlier comments, people assisting are take an oath and swear an oath, and we would hope that they would respect the oath.
And so right, and that's where I was going with this. Are you aware of any widespread occasions where people don't represent properly?
We've certainly not heard of it in our homes in Ontario.
And how about you, Mr. Lee?
No, I have not.
Okay. That's all my questions. Thanks, Madam Chair.
Thank you. Monsieur Terrien, 2.5 minutes.
Thank you very much. I will have a very simple question for you. We know that rapid tests are available, will be distributed soon. How can you use such tests to increase the voting security, to really have a secure voting process?
So, rapid tests are being introduced for staff in long-term care. They are challenging. We do not, as of yet, have a less invasive test, and in fact, it may well be a deterrent because it is a deep nasal swab. And in Ontario, for these swabs, as they're now being incorporated in our province, if you have a positive antigen test, then you will have to do the more traditional deep nasal swab. So those are deterrents, and certainly we've seen it just from a general staffing perspective that the tests now being used, the NP swabs are a deterrent to our staff and have contributed to our staffing issues.
From my personal point of view, having more options available will be helpful if we're faced with an election during a pandemic. They might be used, as one of your colleagues mentioned earlier, to test people, election officials coming into the homes to provide greater comfort that people that are in the homes are COVID-free. I don't have firsthand experience with the rapid testing. I don't believe they're in use in our part of the country just yet.
Okay. Mr. Terrien, go ahead. Mm-hmm.
Oui, je comprends.
Yes, I understand. So the possibility of using such tests, it would be to have electoral workers in voting places, so they could be tested more rapidly. So would that increase the access from electoral workers? That would be the result of the rapid testing.
Assessment would be yes. that would be something that would provide greater access for people to long-term care. If the comfort level was there for everybody involved, that the rapid testing was going to give assurances that they're COVID-free.
Thank you, Mr. Lee. Monsieur Terry, I've tried to provide some flexibility each time for you because I know whenever there's translation, there's a delay that cuts into your time a little bit. Mr. Blakey, 2.5 minutes, and then this panel will end and we will start with our next panel.
Thank you very much. If we look at some of the provinces where there's been elections recently in Saskatchewan, it was 4.5 years between elections for them. In BC, 3.5 years. In New Brunswick, which I think is the shortest period, it was 2 years. I'm wondering if you think that the risk of disenfranchising people in long-term care homes is a factor that politicians ought to be considering whenever there's talk about a snap election on the Hill, whether it's because the government is driving that or because opposition parties are driving it. I mean, do you think that that's something that should weigh in the considerations of parliamentarians when we're determining whether we may go to the polls or not?
Well, I believe, speaking on behalf of the Canadian Association for Long-Term Care, I'm not sure that we're really in a position to answer that question. It's out of our hands when elections are called, and I'm sure that and a multitude of other things are taken into consideration to make such a big decision. We're just happy to be here to discuss the potential of an election and putting the time into planning to making sure that those seniors are not disenfranchised, that we've given them the proper thought and consideration to make sure that they have every opportunity to vote whenever that opportunity arises.
Thank you, Ms. Duncan.
We certainly support the process, and really are unable to speak to that. We know that the governments are elected by the people, and it's a much broader population that the government should be taking into consideration. And
if an election had begun a few weeks ago, do you think that there would have been a substantial risk of disenfranchisement for people in long-term care, or do you think that the long-term care system is election ready?
I do not think the long-term care system in Ontario is election ready right now. We are navigating massive outbreaks and emerging outbreaks in hotspots, and certainly we have a lot of work to do, I would argue.
Mr. Lee?
I would agree. Talking with Elections Canada officials, I know that they've been working on this scenario for the last several months, trying to get ready. I don't think they're there yet. So thankfully, we're not in that position just yet. But every election that comes along catches some people off guard, and they get ready when they have to. So we'll do the same if forced to.
Thank you very much.
Thank you so much.
Point of order.
Yes, Mr. Tucker, I was just about to reply. We have no more time for this panel.
I believe what was submitted to the clerk included a 2-minute round for myself. Can the clerk confirm?
Yeah, what was submitted would be Mr. Tucker and then Ms. Pettypat-Taylor after you for 5 minutes each, but there's no more time in this panel, so we have to cut it off whenever the hour ends and move to our second panel. So you can talk to your right Conservative members and maybe have yourself slotted in one of the other panels.
All right. Okay. Well, my question was for this panel, but all right.
Well, thank you to Mr. Lee and Ms. Duncan. Thank you so much for taking time out today and being here with us. Of course, we want to make sure that our seniors and their civic rights are respected if an election was to occur within this pandemic situation. Thanks for your feedback on that. Okay.
Thank you.
And Justin, you can go ahead and try to switch the panels now.
Okay, we've just admitted the next witness. Just stand by. Hello, Ms. Potts.
Good afternoon.
Hello, I'm Justin Vave, the clerk of the committee. Welcome to PROC. Can we get you to do a very quick sound check for us, for if you can speak for about 10 seconds, and then your panel will start. Go ahead.
Checking the sound, clerk. A trend. First Nations need to be able to participate in the federal electoral system to help shape the COVID-19 recovery. We've borne the brunt of the COVID-19 pandemic and should have a leading voice in ensuring recovery reaches our communities. Elections Canada and the federal government need to ensure the safety of First Nations communities when conducting an election. While I'm sure considerations for mail-in voting have been made, First Nations living in communities with different address systems or unique housing and living arrangements need to be considered when distributing and accepting mail-in ballots. This process needs to be clear and accessible. As for polling on reserve, the utmost priority needs to be placed on procuring the necessary supplies for safe and sanitary voting environment for both staff and electors. First Nations have dealt with the issues of procurement due to remoteness or cost, and this is a serious concern for us when it comes to a large-scale federal election that may come on short notice. Preparations and training should be made at the earliest feasible time. A window of 30 or 40 days from writ drop to election day will mean a lot of moving parts, and the COVID pandemic has shown that First Nations are often an afterthought. I want to touch on the importance of respecting First Nations jurisdiction in regard to polling stations on reserve and in outreach for our participation. The COVID pandemic illustrated once again there's a disconnect between federal, provincial, municipal, and First Nations leadership on who determines safe practices within our communities. It needs to be clearly outlined by the federal government and by Elections Canada that First Nations leadership have the jurisdictional authority to say when something is unsafe or unwelcome in their communities. In our most recent work with Elections Canada, we published a report with a number of recommendations, and I want to share a couple with you today because they remain relevant. Some of the key recommendations that can be implemented relatively quickly are introducing self-identification options in Elections Canada hiring and application processes to better gauge First Nations representation and access to election period paid employment positions offered by Elections Canada. Ensuring that staff running polling stations are adequately trained on acceptable forms of ID. There was evidence that polling station staff turned away First Nations voters who had adequate ID in 2019. Of course, we can't know if this is an act of individual racism or if it has to do with training. We ask you to ensure that there's access to polling stations on reserve where requested. In 2019, some First Nations were refused polling stations. When it comes to sharing information among staff about acceptable forms of ID, there must be training for Elections Canada officials on the history of disenfranchisement and the importance of First Nations participation. First Nations should be hired to staff polling stations and for other vital Elections Canada positions. These are relatively impactful yet easy options to ensure participation. Ultimately, First Nations need to be a part of the federal electoral process should we choose to engage. First Nations have felt the impacts of disenfranchisement and the pandemic deeply. We cannot let COVID-19 exacerbate the issue. First Nations need to be able to have a say in the direction the federal government takes in the COVID-19 recovery effort, and that means ensuring our safe participation in the electoral process. Ensuring procurement of supplies for First Nations polling stations, implementing AFN recommendations on reducing barriers to the federal electoral process, and doing so while respecting First Nations jurisdictional authority will stem the possibility of First Nations voices being stifled. Thank you for allowing our participation today. I look forward to your questions.
Hello, members of the committee. It's Justin Vave, the clerk. We've just lost the chair temporarily. She is attempting to reconnect to the meeting. If I could ask Mr. Doherty as the vice chair to preside the meeting until the chair is back, that would be great. Mr. Doherty, are you there?
Todd may not be available right now. I know he's been in and out.
Right,
I think
okay.
if all of you...
Je peux demander à Monsieur Terrien.
I can ask Mr. Terrien. Mr. Terrien, as a second vice chair, would you chair this portion? Yes, I will do that on behalf of our chair, if I understand correctly. So you can recognize the next speaker, Mr. Tucker. Yes, so I'll give you the floor, Mr. Tucker, for the first round. 5 minutes of questions for our guest. 6 minutes. 6 minutes. Oh, sorry. Yes, 6 minutes. I apologize.
Thank you very much, and thank you for our witness for appearing here today. Ms. Potts, what would be the different challenges with looking with reserve voting versus like on reserve, city reserve issues? Would there be a difference with urban reserves versus regular reserves?
Thank you. Thank you for the question. Absolutely. Of course, there are less polling stations on reserves. There's the issue of remoteness, so people have to travel long distances to get to a polling station. That's the one that comes most obviously to the top of my mind.
And with elders, what would be some of the challenges with elders, as you would see, versus the average aged individuals?
For elders obviously elders are a critical concern in the context of in-person voting during a pandemic because they're more at risk, but to contracting the virus. But in regular elections, their participation is challenging as well because they need support to get to the polling station. They may need language support. English may not be their first language. They may be, their First Nation language may be their First Nation language. So issues of language, remoteness, and the issues of accessibility with regards to disability, of course, are always a concern.
Thank you very much. And also, can you just unpack a little bit your concerns about self-IDing or self-identification, or what you would like to see changed on that front?
On the issues of identification, Elections Canada has a really extensive list of acceptable ID to participate in the election. However, we've seen anecdotal evidence that the polling station staff are not adequately trained on the acceptable ID. So a person during the 2019 election used their status card, which is an acceptable form of ID, and they were refused to vote until that person, of course, challenged the election staff and we're able to speak to the site manager and we're able to vote. But again, in my remarks, we're not clear if this is an act of racism, individual racism, or just inadequate training.
And quick question on elections of chiefs. We've had a number of elections held on First Nations and reserves over the last 9 months. Do you know of any reserve that's actually using mail-in ballots right now for those elections?
I'm not aware.
Because they're all in-person voting, and there's, like with anyone being introduced in new methods, there's going to be and we just had the seniors on, and we're a panel on seniors before you got on, and we were talking about how the tried and true paper pencil ballot is the easiest for seniors to cast their vote. Would there be some troubles with if reserve voting for chiefs and band councils usually are in person? If they haven't utilized the mail-in ballot, there could be some challenges. Could you see that with our First Nations across Canada as well?
I think I don't know if I understand your question clearly, but I am aware that First Nations have undertaken elections and, using protocols to prevent spread of the virus, have done so successfully. But there is, and I'm not aware that First Nations use the mail-in ballot system. It would, and that they're,
No.
yeah.
Yeah, there'd be questionable, people could question the outcomes. There's many First Nations, unfortunately, that aren't, for health reasons, allowing people on their reserves. Would you be suggesting that these polling locations in the next federal election be managed totally by the community, or how would you see this rollout for reserves that aren't allowing non-members to enter that reserve?
Our expectation is that the outreach workers from Elections Canada would work closely with First Nations leadership to establish their preferred to prepare for the election, whether they want a polling station or they don't. They don't want a polling station, to ensure that for those individuals that want to participate, they're aware on how to participate through other means like mail-in ballots.
Thank you very much. I think that's my 6 minutes.
Thank you. Sorry about the technical difficulties. You won't believe my computer overheated because of all the sun that was coming through the window. But I guess it's a good problem to have in November in Ottawa. So next up, we have Mr. Algabra for 6 minutes.
Thank you, Madam Chair, and welcome back. Thank you, merci, Monsieur Terrien, for.
Thank you, Mr. Terrien, for stepping in as.
Question. Thank you, Ms. Potts, for being here. It's really important to include your perspective and your input into our study. We've been asked to offer recommendations to Elections Canada in preparation for a potential election, whether it happens during the pandemic. And we want to make sure that we examine all circumstances, and certainly in making sure that First Nations have access to exercise their right is fundamental element of this process. So I want to ask you to expand a bit on the point where you said the unique circumstances of on reserves for mail-in ballots. Can you expand a bit and tell us what do you think the challenges are there?
I think generally people use post office box as an address and not a legal land description. So in the city, obviously my address is really clear here in Ottawa, but back home, I use a PO box, and it's difficult to understand how to participate via mail-in ballot without a legal land description and if you have a rural address.
So would your recommendation be that we ask Elections Canada to accept a PO box address?
Absolutely.
And do you have any thoughts about because I'm examining the mail-in ballot option because it might be one of the most efficient way of ensuring that everybody, especially at a pandemic, has a simple way to access their rights. So can you also describe or offer your input into how the process should be for soliciting a mail-in ballot, and then how would an individual mail it back? Should there be an intermediary on reserve, or do you have any thoughts on that?
I don't have specific thoughts on how Elections Canada should manage this, other than to say that it's important to get to let band administration know to share with their community members on how that people can participate in the election. So if there is an opportunity to participate via mail-in, I think as early as possible, Elections Canada needs to let First Nations know how that process will roll out and how they can register for the mail-in ballot, and that there be support locally so that people can register, because it is difficult to engage in bureaucratic systems, and particularly elders where English isn't a first language need support to navigate that bureaucracy. So as early as possible and with much support as possible.
I guess I should have also asked your opinion if you agree that mail-in ballot is a good option given the circumstances.
I do agree that a mail-in ballot is a good option. Should it be accessible to rural and remote voters?
The other issues that you made recommendation as well about making sure that that Elections Canada recruits members of First Nation and trains them. Are there any other recommendation, and obviously giving a heads up as early as possible? Are any other recommendations that you think we should incorporate in our report?
Well, like I mentioned in my remarks, I'll just revisit those, making sure that First Nations have access to PPE, should they have polling stations on reserve. Making sure that our First Nations staff, supporting the election is one of our key recommendations. And recognizing First Nations jurisdiction to say, yes, we want a polling station, or no, we don't want a polling station. I think those are key considerations. Those are the key considerations from the perspective of the Assembly of First Nations.
Okay. Thank you very much, Ms. Potts.
Thank you.
Thank you. Monsieur Terrien, for 6 minutes, please.
Merci.
Thank you very much, Madam Chair. Well, welcome. Thank you for being here, Madam Potts. We often deal with First Nations, and sometimes things are done in a kind of a general way, percentages or a certain number of people who have voted. But we do know, and you probably know better than I do, that all of the nations are very different. Their cultures are very different. Each nation is different. So I would like to know, for example, we have the Mohawk community, and they vote a lot less than the numbers which you mentioned earlier. So I wonder if there have been studies that have been, if you've done studies, to know what type of variation can be seen between one nation and another. And why do you know why some nations vote more than others? Do you think there could be studies done so that we could better understand all the variables that affect the First Nations votes?
But yes, I think there are studies that can be done. Obviously, there's positions of some nations where as a nation they don't participate in the federal electoral process because of they consider themselves sovereign, like the Mohawks, and that's a well-documented position. I think, but more importantly, or where we have some more information is on individual motivations. And I think that is an important area of study, in addition to political motivations, there is, also, we've seen studies where if there's a First Nation representative running, there's more likelihood of First Nations voters turning out. So, yeah, so it's an area that definitely needs more study. We have a lot more questions than answers. And I'll just mention that, in addition to individual motivations, positions of nations generally, there's also other impacts, like the timing of the fixed election. So the timing of the fixed election in October falls right in prime hunting season. And so this is the period where people are out on the land and not thinking about going to the community hall and casting a vote because they're busy filling up their freezers and making sure their families have resources for the winter. And so that's a key, that's something that impacts First Nations participation in the election as well.
J'ai l'impression qu'on aurait pu.
I think we could have spoken about this for hours. It's so interesting to try and understand the different reasons for each nation and their desire to vote. I think I'd like to speak about the Mohawk Nation. They're in my area, and I live right near their territory. They're in my riding, and so what I've noted, they don't vote where they live, and they'll vote in Sainte Catherine. So have they been offered the opportunity to vote on their territory and they refused it, or has it not been offered for them to be able to go to a polling station on their territory? That's the question I would have for you.
I think Elections Canada would be a better place to answer any details on this question, but I will say that through our outreach work with Elections Canada, we do through the AFN communication channels, through contacting band administrators, we do reach out to every First Nation to ensure they're aware of, their administration is aware of how to participate in a federal election should they choose to do so. There's an awareness there, but a decision not to for a variety of reasons, which like I would leave to the Mohawk to better explain or share with you.
Okay. Moi, ce que j'ai compris, là.
What I've understood since from the beginning of the pandemic, our Mohawk friends, and I think we can understand their position, since there's a pandemic in Quebec, they have a tendency to stay home to protect themselves from the pandemic. That's what I've understood. I don't want to say anything that would not be true, but do you fear that if they were to have to vote outside of their territory during a pandemic, that would mean that their participation rate would drop dramatically, and it's already very low, and that's a great concern for me.
This morning I heard from one of our elders that in Mohawk territory that there is a real concern about people being affected by the virus, both on both sides of the border. So certainly, the community has taken measures to protect itself. And that's why, in my remarks, I mentioned the importance of mail-in ballots and making sure that that process is accessible to First Nations people living on reserve. And
thank you, Mr. Potts. That's all the time we've got. Mr. Blakey for 6 minutes, please.
Thank you very much. I know in your opening remarks, you'd emphasized the need for jurisdictional clarity and ensuring that First Nations are able to put in place the kind of public health measures that they feel are most appropriate for their community. I'm just wondering what you think the best mechanism for attaining that clarity would be. Is it something that we require legislation for? Is it something that could be done with a ministerial statement? Is there some kind of, is there a need for some kind of joint statement by various levels of government, including First Nations governments themselves, or an MOU or something? What do you think is the most simple and direct method to get that jurisdictional clarity?
With regard to the election and participating in the election, I think really simply First Nations have the jurisdiction, and I don't think any type of agreement is needed to recognize that, like anything formal, because our jurisdiction is inherent to govern our communities. I think clarity with Elections Canada staff and the electoral process is just really important for them to understand that First Nations have the authority to dictate the conditions for safety for their community members.
And so do you believe then that there's a role for the federal government, even if it's just contacting Elections Canada, to kind of remind them of that jurisdictional authority and encourage them to respect it?
Yeah, absolutely. And I hope that this committee's report will help, buttress our recommendations around jurisdiction to Elections Canada and support their staff in an election that's delivered respecting First Nations rights.
Thank you. For First Nations that may well be interested in establishing polling stations in their own communities, are you aware right now is there any kind of dedicated contact person that they can reach out to in Elections Canada to begin doing some of that groundwork now, or is that something that really only begins once an election is called?
I understand that it's Elections Canada has changed the role. I believe it's they're called an RO, but generally the outreach is only available once an election is called. And we did have challenges in the last election in making sure that First Nations and Elections Canada staff and those regional outreach officers were connected to coordinate polling stations in First Nations communities. And so my comment around making sure information is available earlier is, I think that clearly relates to making sure that those staff members or a contact person is available as early as possible for First Nations to reach out to discuss setting up a polling station and making sure the necessary supports for PPE are in place.
And would you say that should also include training for local people if there are people living on reserve who are interested in being poll clerks or occupying some of those positions, that it would be useful to have Elections Canada make some of those resources available outside of an election period so that there's some people on the ground who are ready to do those jobs from within the community?
Absolutely. As I said in my remarks, the 40 or 50-day period is not enough time to do the recruitment and training needed to I think, deliver service for voters adequately.
What advice would you have for political actors, whether political parties or individual candidates who are interested in campaigning in First Nations communities who, obviously aren't going to be able to do it in the traditional way, because we're not going to be able to campaign anywhere in the traditional way? But what advice would you have for political actors who want to reach out to First Nations voters during the pandemic in terms of things they should bear in mind, and kind of how do we go about that in a good way?
I think respecting First Nations authority to determine who comes in their territory. So I would recommend for Elections Canada staff and political actors to contact First Nations administrators directly to ask how they want to engage with political actors.
Thank you very much.
Thank you. Ms. Gladue, you have 5 minutes.
Thank you, Chair, and thank you, Ms. Potts. This has been excellent input that you're providing. So I noted the issue about the mail-in ballots with not having an actual address in some cases for people to use. Do you think that having a polling station on reserve would address that situation for those individuals, or is it still too far for them to travel?
In some cases, I think mail-in voting and making sure that that's accessible is really important for the next election if it occurs during the pandemic. For polling stations on reserve, sometimes people have to travel too far to vote in person. So I think
It may not address all of them then.
Yeah.
Okay. One of the things that's really going to be important if an election is called in a pandemic is to make sure that we have the protection of the people that are voting and the people that are working, in the polling stations, et cetera. And I'm concerned that, a government that can't even provide safe drinking water on reserve, I'm not sure if proper support has been given for PPE and all the kinds of, sanitizers and everything that will be needed. Do you feel like you've had adequate support in that to be able to go forward in an election, or do you have a concern?
As I stated in my remarks, it's absolutely essential that First Nations are provided with the PPE needed to support in-person voting. And I don't think First Nations have those supports right now on hand. And we do have obvious concerns about PPE and the impact on the impact of the pandemic on First Nations, because we know First Nations have been impacted disproportionately.
Mm-hmm. Now, one of the things I noted is that the turnout was lower. What are the things that you think we ought to incorporate in order to make sure that the turnout is as high as it can possibly be?
Voter turnout is a complex issue that has many factors. So there's political motivation, there's the timing, like I said about the moose hunting. So the fixed election date does not, put into consideration First Nation priorities. Making sure that there are polling stations on First Nations reserves when that's requested is essential as well. And providing training, and this is a really simple, very simple recommendation, but providing training to Elections Canada staff to make sure that we're not perpetuating systemic racism in institutions and ensuring First Nations can participate in the federal electoral process should they choose to do so is essential. So making it a process that works for them.
And could you elaborate? You had mentioned that you wanted to make sure that the people that are working on the polling stations don't do things that are unwelcome. Could you give some examples of things that have been done that would not be welcome?
I don't remember using the word unwelcome.
I think it had to do with, people not understanding what the First Nations people, things that are not consistent with the culture. It's possible I misunderstood.
Yeah, I'm sorry that my remarks are not clear.
Okay, no problem. What about if there was a polling station on the reserve? My idea is that throughout the whole writ period, you can always show up and vote by special ballot. Do you think that's something that might encourage a better turnout with Indigenous people?
Perhaps. I think providing as many options for First Nations to participate in the federal electoral process is important.
Good. I think that's my time. Thank you, Chair.
Thank you. Ms. Potts, I just wanted to make you aware that I think you have some other open applications on your computer. If possible, if you could shut those, there's some interference that it's causing. So it may be your emails that are popping up. Next, we've got Ms. Pettypot Taylor for 5 minutes, please.
Thank you so much, Madam Chair. And I also would like to take an opportunity and thank Madam Potts for being with us today. Thank you for your opening remarks, your clear answers, and just your straightforward responses to our many questions that we have. The committee members, like yourself, certainly want to do all that we can to alleviate the challenges that our First Nations communities face when it comes to voting, and many other vulnerable groups, in actual fact. We've talked a lot about mail-in ballots. I come from the province of New Brunswick, and I can tell you mail-in ballots, just for the general population, is not something that we utilize freely here, it seems. It's just kind of something that we just don't think of. But during the pandemic, if we do have an election, we certainly recognize that mail-in ballots will be a tool that we hope that more people will use. Assuming that Elections Canada can make mail-in ballots more accessible for First Nations communities, how do you think that we should communicate the use of mail-in ballots? Like, what should be the communication strategy to make sure that First Nations understand and appreciate that this could be a good tool for them to use to exercise their right to vote?
Thank you for that question. Early communication on the process for mail-in ballots would be essential. Communication in First Nation languages would be helpful. Communication on First Nation local radios, radio stations. I think just early communication on all fronts on that would be helpful to support that option.
Great. Could you also, Madam Potts, elaborate or explain to us what is the relationship between the AFN and the Chief Electoral Officer when we're not in a pandemic, and now that we are in a pandemic? Like, is there a difference with respect to the level of communication that takes place?
I'm just trying to best understand that question. We don't communicate with the Chief Electoral Officer, so I think it's difficult for me to answer that question. We do have we have had a relationship with Elections Canada generally to provide outreach services on the federal electoral process for almost a decade. So when and it's kind of intermittent. So when an election does happen for 2019, we started working to share information with First Nations on how they can participate in the federal electoral process.
And the sharing of information for now, preparing for an eventual election, let it be during a pandemic or not, have those communications started already with sharing this type of information with them?
No.
No. Okay. We also know that we have had several provinces that have had provincial elections over the past few months. I'm wondering if there's any information that you could share with us with respect to best practices within the provincial elections.
I don't have anything to add. I did review the remarks from chief electoral officers in those provinces, and I think that it would be best to reflect on those remarks or go to First Nations specifically who participated in the election to speak to the provincial processes.
Great. And one final question, I guess, again, to alleviate, the many challenges that do exist, and I know that you've given us a summary, but what supports would be needed to really ensure that First Nations can fully, and I mean fully, participate in this process, even if it is during a pandemic?
Again, respecting First Nations jurisdiction, making sure that there's mail-in ballots, making sure that there's First Nations are represented as staff at the polls, making sure that that staff are adequately trained on the history of disenfranchisement that First Nations have had with regards to the elections process, adequate IDs so we don't continue to not disenfranchise First Nations in the elections, and of course making sure that First Nations are afforded the resources, that there are safe and sanitary conditions should there be a polling station in their community.
And very quickly, because I know my time's almost up, and you may not know the answer to this, do you know what percentage of polling staff are First Nations?
I do not, and this is because they do not keep track of it. And this is one of our recommendations in our report to Elections Canada, is that they start to measure this.
Thank you very much, Madame Potts. Appreciate your time.
Thank you so much. Monsieur Thérien, please.
Oui.
Yes. Do First Nation members vote more often at the provincial level or federal level?
I don't have that statistic.
Okay.
And is there a difference in participation percentages in First Nations from one province to the next, or is it pretty similar?
I don't have that statistic available. And I think it varies. It would vary election by election.
Okay. Okay.
Okay. And could we think that in those provinces where there are more members of First Nations that that would make it easier for them to vote because they feel more involved in public affairs? Does that make sense as a reasoning?
Again, it's speaking to factors influencing participation, and I think more research is needed in the number of does the population impact voter turnout, and I don't have that information.
Okay.
All right, one last question for me. When we see one candidate or several candidates from First Nations, does participation increase in that case?
Generally, research has shown, academic research in not just Canada, but in other countries, that people tend to turn out to vote for someone who represents them. So, I can say generally that this has a positive correlation with voter turnout, but I can't say definitively for the Canadian situation. More research is needed in this area.
Thank you. I understand.
Merci.
Mr. Blakey.
Thank you very much. I just wanted to get your view very quickly on the question of how long the election ought to last. And we've heard different things from different groups about what the effect of a longer writ period would be. I just wonder if the FN has an opinion on whether the government should be looking to have a relatively longer election period within what's permitted in the legislation, or tend toward a shorter writ period.
The AFN does not have an opinion on the length of the writ period, but we do, as I've mentioned in my remarks a couple of times, feel that earlier communication would be positive on how to participate in the electoral process.
I know we've spoken a lot about First Nations communities. I'm just wondering if there's anything beyond what you've said already to do with urban Indigenous populations that you think it's important for the committee to consider barriers to voting that they might face as a result of the pandemic, and things that we could be doing now, either Elections Canada or the federal government, in order to reduce those barriers.
I think the recommendation on training on acceptable forms of ID is just as applicable to on-reserve voting stations as off-reserve. Inadequate training or incidents of racism can happen anywhere, not just in rural and remote settings, but also in urban settings. So that's really important that elections staff or polling station staff and volunteers do not perpetuate systemic discrimination and marginalize First Nations people from participating in the elections process, even when they have adequate ID.
Okay, thank you very much.
Sorry. Next, we've got Ms. Vecchio, please, for 5 minutes.
Thank you very much. And thank you very much, Ms. Potts, for joining us today. If we're looking at looking as an overview at the reserves, I recognize that many are remote. Many don't have the access to the general public facilities that we have as well. When you're looking at the reserves, would you say 100% of them, or what is the percentage of them that actually have voting and polling stations on reserve during a general federal election?
I don't have that statistic available. It is available though, and it is in our report.
Okay. So, but there is a percentage of some having and some would not have polling stations actually on their reserves. There would be some polling stations without, or there would be some reserves without a polling station. Is that correct?
That's correct.
And those polling state or those areas that we're referring to, is it because of them being further remote? Do you know some of the reasons that a polling station may not? I recognize that sometimes, for instance, you refer to the Mohawk First Nations. I'm just wondering specifically, is it because they're not welcoming, or is it just because it's been a true oversight and Elections Canada should have done a little bit more due diligence? What are your thoughts on that?
There's the situation where First Nations don't want polling station, and there's a situation where First Nations do want a polling station and they were refused. And it could be timing or poor communications between Elections Canada staff and First Nations.
So, and those people that are off, that are on reserve but are being made to vote off reserve, is there challenges to getting to those voting stations, or what are some of those challenges?
Transportation is a challenge to participate in voting off reserve.
Okay. Now, when they're looking at it, does the Elections Canada as a whole look at on reserves, or is it done by the local returning officer to verify what needs to be done in each constituency? Do you know?
Could you ask the question again?
Well, because I'm looking at, like, in my riding of Elgin Middlesex London, we have Carrie Snyder, and she is in charge of this area, finding all the polling locations. In an area that has both off and on reserve, does Elections Canada assist with on reserve, or is it the returning officer who is local that has to work with the reserve at the time?
It's the returning officer, and so this is key because they're not returned until far too late.
Okay.
In our opinion.
No, well, that's a good opinion. That's great to understand. But do you think that maybe with the federal government working closer with First Nations and closer with Elections Canada, that we can maybe, like, to me, if a First Nations wants a site there and we're going through a pandemic and they have the ability to have poll clerks and everything there, it would be very useful. And then you're not bringing strangers on reserve. So I'm just wondering what the best method to make sure that all are at the table to have these discussions would be.
The returning officer and communication between First Nations administration and that person is really critical, and that's who sets it all up. And if the AFN, if we're supporting, information sharing, we actually don't get that information until far too late, and it's not available to First Nations administrators far too late.
Okay.
And this is a recommendation that is included in our report to Elections Canada as well. So that's a key position that enables an effective polling station, and of course impacts the staffing of that polling station.
Absolutely. And if you have people that are actually living on reserve, like you've said, you're trying to promote more Indigenous people working at these polling stations. This is a kind of a sweet situation where we're actually fixing both things, where we're not bringing people on, and that the poll workers will actually be from those communities as well. So to me, it might be the right fit. When we're talking about the mail-in ballots, because I know that we've spoken to a lot of long-term cares, we've spoken to different communities. Do you think that would be a useful resource for mail-in ballots for First Nations? Do you think it would be better having more ample time for mail-in ballots, or should we focus on locations on reserve for polling stations?
I think there needs to be both. The First Nations community is vulnerable to the pandemic, especially the elderly, and there needs to be, mail-in ballots need to be accessible to them and those who don't want to vote in person but still want to participate.
Yeah. Oh, I don't see Ruby moving yet, so I'm going to keep on asking. You are moving.
I thought you were going to finish right there.
Yeah.
Okay, we have, I guess, a minute or two. Is there a Liberal member that would like to take maybe a 1 minute question before we switch into the next panel? If not, then I will.
Point of order, Chair. Just, we had 2 minutes left in the last panel, and you did not allow me to ask my quick question that I had, and there was 2 minutes left. Now you're asking if there was a Liberal that had a 1 minute question.
There were not 2 minutes. There were not 2 minutes left. I said I would be stopping 5 minutes before the hour, and we had gone past that even. At this point, we had 1 minute, but now we're at 5 minutes to the hour as well. So we have no more time. And we'll switch into panel number 3. I would have definitely gave it to you, Mr. Tucker. We were at, we were beyond the hour mark at that time. So, but anyways, Ms. Potts, thank you so much for being here today. And thank you for your testimony. I know there were many questions and you did a wonderful job in answering all of that and giving us some input as to, the views that AFN holds. So thank you. And team will get set for the next round of witnesses. From the Council of Canadians with Disabilities, we have Jules Smith, the past chair, and from the Canadian National Institute of the Blind, we have Miss Bergeron, Diane Bergeron, and we've had her before at this committee as well. So welcome to both of the witnesses and welcome back to Miss Bergeron. We look forward to hearing your testimony, and you both have 5-minute opening statements. We'll start with Ms. Smith.
Good morning, Madam Chair and Committee, and I guess it's afternoon for some of you. Thank you for inviting the Council of Canadians with Disabilities to appear before the committee. So the UN Convention on the Rights of Persons with Disabilities in Article 29, participation in political and public life, requires state parties to ensure that voting procedures, facilities, and materials are appropriate, accessible, and easy to understand and use, and to protect the right of persons with disabilities to stand for elections. These rights are not altered by a pandemic, and we are confident that by following principles of universal design, the duty to accommodate, and nothing about us without us, it will be possible to ensure that voters with disabilities are not disenfranchised by COVID-19 pandemic or discriminated against by any new barriers that would make voting more inaccessible. During the pandemic, accessible communication to people with disabilities concerning access to the electoral process is very important. A twin-track approach to communication would be beneficial, focused accessible communication directly from Elections Canada to people with disabilities, and communications to people with disabilities by their own organizations on behalf of Elections Canada. It would be helpful to people with disabilities if Elections Canada increased its capacity for direct communication with people with disabilities so that voters with disabilities are not frustrated or discouraged by not having their inquiries answered in a timely manner. During the pandemic, people have questions about how their needs will be met, and it is discouraging and frustrating when these inquiries go unanswered. It is recognized that if an election is called during the pandemic, it will be necessary to have appropriate distancing measures, sanitizing practices, along with various forms of PPE. A disability and human rights lens must be applied to how these are rolled out. When constructing the layout of polling stations that conforms to COVID-19 safety measures, the principles of universal design need to be followed, and design and practice testing by qualified people with disabilities needs to take place to ensure that the design and practices do not include barriers to voters with various types of disabilities. Sanitizing agents that do not exacerbate environmental illnesses, allergies, asthma, and other conditions also need to be used. And some individuals, due to their disabilities, are not able to wear a mask or face coverings, so these voters with disabilities need to be accommodated at the polling station or at an Elections Canada office. Accommodations need to be available both for voters with disabilities and employees with disabilities. Due to the need for physical distancing, at some polls it may be necessary to limit the number of people in a polling station. As it is difficult for some people with disabilities to stand for prolonged periods of time, it may be necessary to have, as an accommodation, a priority access line for people for whom long waits would be a barrier to their participation. The application process for the mail-in ballot does not include an internet-based application option. It would be helpful to have this type of option added, because at this time, those who are trying to avoid exposure to COVID-19 may want to avoid going to a postal box, and not everyone has a home fax machine. Further, an option for phone-in voting is highly recommended. There are concerns about how a voter must establish their ID for voting. A voucher can only vouch for one person. With the number of people who are seeking to limit their personal contacts, it may be difficult for people to be able to find someone willing to go out in public to vouch for them. To alleviate this situation, vouchers should be allowed to vouch for more than one person. Elections Canada hires Canadians to work during federal elections. For example, there are community relations officers for accessibility. It is recommended that Elections Canada hire additional community relations officers for accessibility to ensure that new barriers are not created as the COVID-19 response is developed. It is also highly recommended that additional communications personnel be hired by Election Canada to ensure that there is sufficient messaging to people with disabilities about access to the electoral process during COVID-19 pandemic. Additional outreach needs to be done to Canadians with disabilities who would be interested in working for the elections in these positions or other positions. This outreach should include how employees with disabilities would be accommodated during the pandemic. And the Council of Canadians would be open to working closely with Elections Canada on messaging to voters with disabilities and on barrier prevention. And I thank you and look forward to your questions.
Thank you, Ms. Smith. Ms. Bergeron.
Am I unmuted?
Yes, you are.
Okay, thank you very much. I'm Diane Bergeron, and I'm just going to ask for a second as I set up my adaptive equipment. As a person who's totally blind, I use various technologies to help me in my presentations. So thank you, Madam Chair. I'm Diane Bergeron, and I'm here on behalf of the Canadian National Institute for the Blind, known as the CNIB. There are approximately 1.5 million Canadians with sight loss. Sight loss is a spectrum. There's no one-size-fits-all approach to removing barriers for people with sight loss. So CNIB has been around for more than 100 years, and during that time, we've supported and provided assistance to people with sight loss. Now we're in this great world of pandemic, someplace that causes confusion and complications for everyone, and people with sight loss are no different in that situation, including in elections. For over 90 years, CNIB has been advocating tirelessly for accessible elections. In the 1930s, CNIB led the charge for the passage of the Blind Persons Voters Act, which stopped the practice of a voter who was blind or partially sighted from sharing their vote with Election Canada officials and party scrutineers vocally and out loud. Can you imagine? Not being able to vote in secret or independently. We've come a long way, but barriers to our independence remain, and that includes in elections. CNIB has heard from Canadians with sight loss across the country where a pandemic election has taken place. In New Brunswick and Saskatchewan, we heard from the community about anxiety and frustration about how to independently mark a mail-in ballot. Without the accessibility tools that are offered in an election, like a magnifier or braille indicator template, it's difficult for someone with sight loss to mark their ballot. While many people who are blind or partially sighted may have access to assisted devices, to help with their vote, it should not be assumed that everyone does. It should be mentioned that the tools provided by Elections Canada do not fully provide independence for someone trying to vote who has a disability. It's more of a stopgap measure to assist in the voting process. However, in British Columbia, a tool to help people with disabilities vote independently should be replicated by Elections Canada. Vote by phone, that's very hard to say, vote by phone has become a safe and independent way for someone with sight loss to vote without having to use an inaccessible paper ballot or without the assistance of a sighted guide. Elections BC and the Government of Australia have implemented a system where those with disabilities are able to verify and mark a ballot by phone. Not only is this helpful in a pandemic where a marginalized population is at greater risk of exposure, but would be another tool in the toolbox to combat barriers to independent voting. In both instances, and to the best of our knowledge, there have been no issues with voter fraud or coercion. This method of voting helps to eliminate another barrier that we have. That's to get to a polling location. For many who are blind or partially sighted, they must rely on a family member or friend to drive them to a polling location or take public transit. In rural or remote communities, this may prove to be more difficult due to the lack of public transit options. If the government takes the suggestion of the electoral officer to move election day from a Monday to a Saturday or Sunday, this also presents an issue as many transit operators have reduced or lack of service on weekends. Taking a ride share like taxis or Uber also presents a financial barrier as well. Voting by phone will eliminate these barriers. Again, I'd like to thank the committee for inviting me to testify on behalf of CNIB, and I'd be happy to take questions from members of the committee to better explain the voting process for someone who's sight lost. I've gone through these processes myself, and I know how difficult it is when you have a disability to go in, be independent, and utilize your rights of being able to vote independently and in secret without having to give out information to others. Thank you.
Thank you, Ms. Bergeron and Ms. Smith. That was very valuable. And of course, we don't want to create any more barriers as we're trying to make sure that an election can be run safely. We're going to start with 6 minutes with Ms. Vecchio, please.
Thank you very much. And a special thank you to Jules and Diane. This is a very personal way of looking at things because, we're talking about general Canadians, but what you're bringing to the table are factors that need to be considered as we're moving forward because it is so vital that every Canadian has the opportunity to vote. And thanks for bringing forward the concerns and barriers that not only yourselves, but others that you work with are dealing with. To begin, Jules, I really liked that idea of the priority access for disabled, making sure that, there's appropriate lines and things like that. That is one of my greatest concerns is if we're asking seniors or people with disabilities to go out and vote and there's a 2-hour lineup, how can we expect them to do so? How did the priority access, how have you found that have you seen it being used in the election so far? And if so, what's been the response?
I haven't seen it used. We did just have an election here in BC. I was able to vote by mail. I have an autoimmune condition as well as a mobility disability, so I accessed that. And having not seen it, I don't know. I don't have that personal experience, but I've seen it work in other places. For example, when I've been in Europe and I've gone to the museum, I don't have to stand in the 2-hour lineup, which would then mean that I could maybe only do one floor of a museum due to my disability. So it's been done in other spaces, and I just really hope that this is taken into account.
So just adopting that method and bringing it forward. It just sounds to me just so simple, and why would we not just be putting that forward? It just makes appropriate sense. And as you're both indicating, transportation is definitely an issue as well. So one thing that I look at is we've really heard of the uptake in mail-in ballots. We've seen that, and the Chief Electoral Officer is also anticipating a much higher mail-in ballot turnout. But I would like to start off, with Diane. Diane, you were talking about these ballots. What are some of the things, considering with the CNIB, what are some of the things that we need to consider on a ballot for those who are visually impaired, that if we're mailing them a ballot, what things do we need to take into consideration that it is appropriate for who's receiving it, that they can use this?
Thank you very much. So people with sight loss, as I said, is in a spectrum. So very important in any ballots to make sure that the print is very clear, that it's very plain text, that it's got some good color contrast, and that the print is large enough. And that will really assist for seniors and other individuals with some partial sight. For those of us who are blind, we do have our Braille templates that we use in the elections right now. And that really helps me because I'm able to mark my own ballot. What it doesn't allow me to do is to verify that I have marked my ballot correctly. And so at this moment in our current situation, there is no way for someone who's totally blind to be able to mark it and verify it without having someone else to assist them. If you're going to do a mail-in ballot, one of the things that we were working on with Elections Canada was having an option to have a ballot sent to an individual through email, a PDF, fillable PDF, so that they can fill it in on the computer, on their computer, not online, but on their computer, print it off, and then be able to put it in their envelope and sign to send back. And then a tactile indicator as to where to sign would be extremely helpful. CNIB can help during that process by setting up stations around the country in our various offices to allow people with sight loss to go in and use a computer to print off their ballot and print it off if they don't have the equipment at home.
Wow.
Those are some of the ways we could help.
No, that's very useful, Diane. Thank you so much. It sounds like there's been so much groundwork and homework done on this beforehand that, these are things that we would be able to move forward with. Just one of my concerns when we're talking about disabilities is a lot of times if ballots are sent out, you're going to actually have to print in the name because a special ballot, there may not be all the lists of official candidates until so many weeks into the actual campaign, and we're looking at timeframes. I'm just thinking, and gosh, you've got my wheels turning in here about what we can do on a computer, but what are some of the things, and this is where I'd say that we would probably have to make an election longer so that we can make sure that people get appropriate ballots. Are there other considerations that we should take in at that time as well, Diane?
Sorry, am I unmuted?
Yeah, I can hear you.
Okay, sorry, this is a little confusing. Yeah, I think that, absolutely, there's some of those issues that we're facing around the templates, and the ballots aren't ready until just before. I think that working with organizations like CNIB and CCD and other disability group organizations, I think that there's a solution out there. We just need to work together to find it, and having it tested by people with the disability that you're trying to accommodate is extremely important, because you won't know if it's going to be accurate and actually work unless we're right there testing it.
Absolutely. Jules, moving over on to you, because not only are we talking about an election during this pandemic, but everyday situations that are impeding Canadians right now because of the pandemic with those with disabilities. What are some of the, because I just want to start at bigger picture than moving into an election, what are some of the biggest challenges you're finding for people with disabilities at this time during COVID-19?
Some of the things that I noticed, I did a review of WorkSafe BC and other responses to the pandemic just with a disability lens, and I realized that there was not a consideration in the setups that were created. There was no conversations with people with disabilities on how these would set up new barriers for us. So these clear plastic barriers that somebody with low vision might not be able to see. There are signs on floors that some people can't see. It doesn't accommodate for wheelchairs in many spaces. They're not wide enough, or the distancing doesn't allow for the space of a wheelchair. I have a service animal. I have a lot of concerns about bringing my service animal into public spaces at this time. And I know that people who use guide similar, have the challenges that are being communicated among the community on how we can figure these things out. But I think that the biggest barrier I've seen is just this rapid response with no consideration to our population. We're 1 in 5 Canadians live with a disability, and yet we were not consulted at all about all of these brand new things that just leapt up in society.
Well, and thanks for bringing, go ahead. Okay. Thank you so much to both Diane and to Jules. You had so much to offer. Thank you.
Thank you. Mr. Turnbull.
Thank you, Madam Chair, and thanks to Ms. Smith and Ms. Bergeron for being here. Really appreciate your perspective. I think there's a lot of really important facets of the elections process that we've really got to look through the disabilities lens and really understand how to make the process more accessible. I mean, that goes without saying that we need to do that in normal times, but in COVID-19, this is even more important than ever. I find myself saying that a lot, actually. I have lots of questions. I'm going to start with one about, I understand that both of you, I think, are on the advisory group for disability issues with Elections Canada. Is that correct?
Yes.
Yes. Okay.
Yes, we both are.
Great. And what does your relationship look like with the Chief Electoral Officer? How are you being engaged in that process? And you know, could you just tell us whether you think it's satisfactory or you think that there maybe needs to be more input, more meetings? How can that process be improved to make sure you have as much input as possible into the process? Ms. Smith, maybe you want to go first?
Sure, I'll go first. So not specifically with the Chief Electoral Officer, but with the staff who engage with the Accessibility Committee. I've been in contact already extensively. We are about to have our I guess, semi-annual meeting shortly. And they also did over the summer a check-in with our committee on how things were going and our thoughts if there were to be an election. And another thing is they've approached me to help to put together a speaker's opportunity to talk about accessibility and voting, in particular because in BC we've just went through this process, and they think it would be useful for government and Elections Canada staff and returning officers to hear us. So I feel like we're very engaged, and I'll just hand it over to Diane.
Thank you.
Yeah, thanks, Jewel. I would agree and echo Jewel's comments. I find that with Elections Canada, it's a really positive relationship with the committee. And although not every suggestion that we put forward is possible based on the fact that the legislation is there, and a lot of the suggestions we have means you have to open up the legislation to make some changes, Elections Canada is very creative in trying to do what they can to make sure accommodations can work within the boundaries of the legislation. And I think that a key message there for me is now that this is being looked at, maybe this is the time to open up that legislation and make those accommodations possible.
Great. Thank you for that, and points well taken. And I know that that's part of what this committee is considering in its interim report is some of those legislative changes. So I appreciate that. Is there, like, I want to know why you say that. Is there specific elements of the flexibility that's required by Elections Canada that would help to meet the needs of people who live with accessibility issues? Can you maybe speak to that? Are there specific things that you think require legislative changes from your perspective?
I'll just jump in. I know, Diane, you have a few, but one thing that we've really been pushing hard, and People First is also on the committee and they've talked about, is the ability to have a person vouch for more than one person. That would make a tremendous difference in a general election, but in an election during a pandemic, I think it's really critical that we have that possibility.
Thank you for that. Ms. Bergeron?
Yeah, I think some of the things that have come up at the committee level for people with sight loss, of course, it's having those alternate ways of voting, the telephone voting or potentially online voting if there's a safe way to do that, and having other options using technology and various types of technology that we can use to vote independently. But one of the other ones that came up quite frequently at our committee was having, we have Braille lists of the names of the individuals that are being on the ballot, But there are people out there that have no ability to read or limited literacy skills, people with various disabilities and cognitive levels. And it's important to potentially have photographs, pictures of the individual next to their name so that people know who they're voting for. So those are some of the things that were put out. And again, the ballot itself is within, it's my understanding within legislation, the ballot and what it looks like is all set within legislation. So maybe having a look at that ballot and how can we make it fit as many people as possible to be able to read it.
Okay, thank you. Those are really specific suggestions, and I appreciated your opening remarks. Both of you had very specific suggestions, which I really appreciate. So all those points are well taken. I want to ask one other question about the twin track communications, which Ms. Smith, I think you opened up with, which I feel is a really big contribution to this conversation. Can you speak a little bit more about what that might look like in terms of coordinating with some of the accessibility organizations across Canada?
Sure. I think it's really important to use multiple ways of reaching out to community. So TV and radio, I know that some of the earlier speakers today talked about, using specific modes in the community. So maybe radio is a preference in rural, but also reaching out to our organizations. We have very large mail groups that we send out weekly notices to at CCD. We also have social media to amplify. So if we were working closely, all of our organizations, we could definitely be doing that outreach. And I know, as Diane mentioned, CNIB has the ability to help in person for folks. So all of those modes are really critical to us. And I know that really reaching out to the community is important. And I'm not sure if you're aware, but the Council of Canadians with Disabilities is made up of different organizations represented at our council. So we would amplify it straight out to all of our provincial and territorial affiliates as well. Thank you.
Thank you. Monsieur Thériault for 6 minutes, please.
Merci, Madame la Présidente.
Thank you, Madam Chair. I'm very pleased to meet with you this afternoon. You attest of a reality that we do not know enough about, I think. And maybe we tend not to really seriously envision the different problems that you have to live with. Before talking about the pandemic, I would like to know what is the participation rate of people with disabilities. Is it similar what we note with other groups, or is it lower, the participation rate?
I'm not sure who that question was aimed at, but I can say that we actually don't know how many people with sight loss in Canada are voting, since the vote is secret. Of course, there's no way for us to be able to have specific statistics on that. So unfortunately, I can't answer that question.
And I would say that as well, those statistics are not available to us.
You don't ask the question to your members. Maybe you could have an internal survey to see if everything is going well with your members. So you did not want to have such a survey. I just wanted to know. It's not a problem. So the analysis wasn't done by your organizations?
An analysis after the last election in regards to the experiences of individuals in their election process, but it was not we did not ask the question how many.
Okay.
So you're interested with the process. You want to know whether your members have had difficulty, challenges, and you want to have their participation improved. That's what I understand. Yes, it's very laudable, this goal.
Yes, that was the purpose of our survey, was to make sure that we knew what the challenges were, so that when we're participating in in committees such as the Elections Canada Committee and also presenting here, that we would have some information about what those experiences were like and how to potentially improve them.
And I would just say with the council as well, we do conversations and outreach whenever we are meeting with the committee to discuss any recent barriers that were experienced or concerns or ideas. We always bring those forward, but we do not have the capacity at this time to run a large survey.
Were you told by some people that they would refuse to go and vote because of the pandemic? They're too afraid, because some people can say that they're afraid, and they say, well, as long as there's a pandemic, I will simply not vote. Are there people that are so afraid of the pandemic that they told you that?
I'll just take that because, as I said, we just did have an election in BC. I didn't hear from anyone that they were too afraid to vote. We have a lot of options in BC. People were able to have the mail-in ballot or the phone. So it was more about solutions to vote is what I was hearing. Thank you.
Même chose pour Madame Bergeron.
And Mrs. Bergeron, would be the same thing with you?
I haven't heard of anybody specifically who has been concerned about voting in the election with due to COVID. I've heard a lot of concerns about people not wanting to go out and interact in public due to the COVID. Guide dogs don't understand physical distancing. We can't follow the pathways on the ground. So it's been very difficult for people with sight loss to go out and do their daily activities. As for refusing to vote due to COVID, I can say I haven't heard anything specifically about that, but I have spoken to some people who are blind who have said they're not voting until they can vote independently in secret, like every other Canadian has the right to do. So there is some folks who are not voting because of the lack of accessibility, but they haven't said specifically around COVID.
Je comprends.
I understand. And the mail-in ballot, you've used that in the past, and you would like it to be more accessible today? The vote by mail?
If the vote by mail option was more accessible, I think that you would find there would be a much higher rate of individuals. This is just anecdotal and from my opinion. I think that you would find there would be a lot more individuals that would be willing to and able to vote, but that process would need to be accessible in order for that to happen.
And just speaking, from not specific to the blind community, but disability in general and people who live in rural and remote places in BC, I know that the mail-in and the phone-in options were really well appreciated for voting, and I heard there was quite a bit of participation. Thank you.
Thank you. Next, we've got Mr. Blakey for 6 minutes, please.
Thank you very much. My opening question is similar to Monsieur Terrien's, but I'm just curious to know, in light of the barriers that exist to voting and the complications of the pandemic, if those barriers aren't addressed, are you concerned that there could be a significantly lower voter turnout among Canadians living with disabilities?
Sorry, were you addressing both of us?
I am indeed, yes. I'm very happy to have you start, Ms. Bergeron.
So from my perspective, as long as the situation with COVID is in place, you are going to have a significant drop in participation from people with disabilities. And in my particular case, I'm thinking of people with sight loss, because of the fear of going out. And it's not a fear for I would say, getting COVID as much as it's a fear of the reaction from the people around you in a social situation, in a community situation, where people get upset and angry because your dog can't figure out where the lineup is and which direction you're supposed to walk, or with your cane, it's not tactile on the floor and you can't see the signage. And it's such a stressful, anxiety building situation that I expect that you will see a significant drop in voting capabilities or the voting participation, during the next election for those reasons from people with sight loss alone. Again, that's just anecdotal and just my opinion, but I do think there will be a significant reduction unless something's done properly.
I would agree as well. If the issues are not addressed, we know that people with disabilities who live in long-term care homes or settings like group homes and such are going to have challenges. People with mobility disabilities and not being accommodated at spaces might be a problem. Individuals with autoimmune conditions are going to have concerns about going out and voting, as well as people with communication disabilities. Ensuring that they have the support person with them to assist in any voting is also a priority. Thank you.
Thank you very much. One of the things that's been discussed through a number of our panels has been the length of the writ period, or essentially how long the election ought to be. And I'm wondering if either of you have an opinion on whether we should tend towards a longer or shorter election period, and if you think that that would matter to the people that you represent in terms of Elections Canada having more or less time to be able to prepare ballots in the appropriate way and polling stations and things like that.
I would strongly suggest, especially during a pandemic, to have a longer writ period. In BC, we had a very short one, and I know that it was very difficult for people to get the names of who was running for positions ahead of time and make decisions about voting and get the mail-in ballot in a timely manner. However, they did alleviate that to some extent by extending the number of days we were able to vote, which was good. But having a longer writ period would definitely, if the issues of accessibility were addressed, would definitely help.
I think I agree with Jewel. The longer the period, the more options people have to, or opportunities people have to prepare for their accommodation needs. I also think it provides Elections Canada a longer period of time to get accommodations in place and to make sure that the communication is out there and to the people that need it as to what accommodations are going to be prepared for them and available to them for their elections experience. So I would say that yes, the longer the period you have, the easier it's going to be for Elections Canada and the easier it's going to be for people with disabilities to prepare. I also think the more time you give during the voting piece, if you have, 3-4 day time frame to have people vote, it gives people an option to get different transportation options in place or get the supports they need in place for different times.
Thank you very much. And if I understood the conversation correctly earlier, you were saying that there were some suggestions coming out of the Disability Advisory Group for Elections Canada that would require legislative changes, and so are harder to make. And I'm just wondering, in this context, if you'd like to share some of those recommendations, given that I think it is very likely that the Act will be opened up. What are some of the things you think are most critical to reducing the worst barriers for people living with disabilities in the event of an election held during a pandemic? And we could start with Ms. Bergeron and then go to Ms. Smith.
So yeah, thank you very much. I would really, as a person who has never, ever in my entire life in Canada been able to vote independently and in secret, I would really appreciate the opportunity to have those options of telephone, online, any other option that doesn't require me to go into a polling station and ask either have to take someone with me to confirm my ballot or have to tell some stranger that's at the polling station to help me. I know that the folks that are there take an oath, and I've said before, an oath is fantastic, but it's only a word. And as I mentioned to Elections Canada, when we talked about the oath, I expressed that my husband gave me a vow a long time ago, and he's now my ex-husband. So that tells you with the divorce rate in Canada how much an oath means sometimes. So I would really like to see us being able to put things in place like those alternative measures with using technology to give us that ability to do it independently. And if it's opened up, if the legislation is opened up and that happens, I would be eternally grateful to feel independent in this process for the first time in my life.
Thank you
Thank
very
you, Ms.
much.
Bergeron. Next, we've got Mr. Tucker for 5 minutes, please.
Thank you so much, and a personal thank you for our witnesses on the work that you guys do every day on behalf of your members. The 1 in 5 Canadians that are living with disabilities are, I'm sure, very appreciative of your hard work to make sure that people with disabilities can live as much as possible normal lives, just like every other Canadian. So thank you for your work on that regard. My questions are a little bit about what would be ideal. So we talked about the RIT period. The longer the period, probably the better possibilities. We have the example in BC where it was, I believe the witness said it was a little too short and made challenges for people with disabilities. Another aspect is we live in Canada, and I very envious of Diana out in, I believe, BC. When I'm in Saskatchewan right now with a couple feet of snow in my driveway. So what are the, and I think everyone knows this answer or to this question, but I'd like to hear you guys talk about the perfect timing for an election for someone that has the disabilities. Is it in the middle of winter or in the middle of summer? And what does that kind of change in with the members that you represent? Diane?
Yeah, thank you. Actually, it's Jewel that lives in BC, and I'm also very envious because right at the moment I'm in Edmonton and we have snow and cold. So I would say for people with sight loss and individual other disabilities that I know, the winter is a challenge, right? Things are not shoveled, and it's very difficult to use the tactile indicators that you have on the ground in order to get around. Your sound is muffled because you've got a hat on and earmuffs and stuff. So I would say anytime that there's no snow on the ground, the better is the best timing when it comes to seasons, I would say.
I would echo that. And yes, I'm in the beautiful coast part of BC, but I know that back home in Revelstoke, there's snow. So I would agree that times when there's not as much snow is very, very important and much more accessible for people who have disabilities, also people who are living in rural and remote communities as well are better accommodated in the better seasons. I'm not sure that the height of summer would be so great because we know kids are off of school and people have vacations and such, but at some point in the year, there's plenty of months where there isn't the snow and ice that are such issues.
And a quick yes or no question: if you had your choice, would I've heard there's issues with transportation, obviously on weekends versus a weekday. Would you hold it on the traditional Monday or on the Saturday, Sunday? Diane?
I would say Sunday, Monday, because that would give the opportunity for people who needed to get friends or family members to help them. Sunday's probably the day that they'd be off work. And Monday, the transportation go backs, or a Friday, Saturday, if Sunday's an issue. I would say one weekend day and one weekday for the public transportation and the availability of other people to help.
I would echo those.
And I'll tell a little story. Back in 2011, I ran provincially, and I was on election day going to help or drop off lunches for my scrutineers at the assisted voting location. So it was a place where people had mobility issues or other disabilities issues that needed additional assistance. And it was the only time that I was actually scared in an election that I would be unsuccessful, where my wife and I were walking in and there was an individual that was being helped in a wheelchair. And the worker didn't recognize myself or my wife, but we were walking behind, and the worker was with the last instructions helping this resident to go vote, said, "Remember Tommy Douglas, remember." And it was a sinking feeling that there was undue influence on people in a voting station that potentially could impact the election. Now, take that example, and with an individual that just didn't have mobility issues but had additional disabilities, can really affect how things go. So I would be very, and I do share your concerns or your desire to make sure that everyone that wants to vote can vote. You talked about in the past how you had to verbalize or share your vote with the would-be worker. In British Columbia, though, there has been, or sorry, not British Columbia, we had elections in New Brunswick that didn't have also as much COVID precautions or concerns as what was going through BC. So it's kind of, our country is so vast that there's a lot of different examples of we may need something different here versus in another province or vice versa. So I'd like to hear a little bit about the voting station idea, that it was be dedicated just for people with sight issues. So I guess that question would be for
Mr. Tucker. I've let you go over by a minute just so you could get your question out, but it was a long question.
I had 141 was my cutoff, so, but okay, I digress.
I just wanted to throw you in a minute there because I know you want to had some time that you were expecting before. Ms. Duncan, 5 minutes, please. Dr. Duncan.
Thank you so much, Madam Chair. And I'd just like to thank Ms. Smith and Ms. Bergeron for being with us and being so generous and bringing your tremendous experience and expertise. Ms. Smith, could you tell us how many organizations you represent in CCD, please?
Sure. Of course, my service dog is getting a little noisy right now. Yeah, we have 17 organizations that have council seats, and we have 2 at-large seats that are other members from across the country, and we also will be having 3 more seats that we've just approved.
Thank you. Could you table with the committee the names of those organizations? Would that be possible?
You're really testing me.
No, at another time.
Oh, at another time. Okay, yes, of course I can. Yeah.
Thank you. Can I ask, does Elections Canada engage CCD? Does it engage the council it has, or does it engage each of those 17 organizations?
So I know a number of my colleagues that are in national organizations have a seat at the advisory committee. For example, Frank Foligno previously was one of the members, so he represented the Deaf Canadian Association of the Deaf. And we also have People First is represented, and there's a number of individuals, not necessarily attached to their organization, but that do sit at council who are there. So it's a pretty diverse, sorry about Da Vinci here.
Thank you.
Pretty diverse group, thank you.
Thanks, Ms. Smith. Could I ask, would you be willing to table with the committee specific recommendations? You and Ms. Bergeron talked about recommendations you had into Elections Canada. Would you be willing to table them at a later time with the committee? What recommendations you have to make elections easier, please?
Of course.
Thank you so much. Ms. Bergeron, could I ask, does Elections Canada consult CNIB directly?
Yes, I sit on the committee with Elections Canada, and I work with my colleagues on various projects for Elections Canada to make sure they're getting the appropriate responses, not just Diane's opinion, but the CNIB's vast knowledge base.
Thanks, Ms. Bergeron. Could I ask you the same question? Would you be willing to table with the committee recommendations that CNIB has made to Elections Canada to make elections easier, please?
Absolutely, absolutely.
Thank you so much. Ms. Smith, could you talk about how COVID-19 is impacting Canadians with disabilities who live in group residences, please?
For sure. I mean, there has been a lot of press about long-term care facilities and our aging population, but many people don't realize how many people with disabilities live in those settings because they don't have appropriate and accessible housing within the community to live in independently or with friends or whatever. So the population is equally being impacted as our aging population. Those who are in those settings are experiencing the isolation during the lockdowns that have occurred. We do know, not necessarily coming out of Canada, but other countries, that people with certain disabilities seem to be have higher death rates if they contract COVID-19, including people with developmental disabilities seem to be passing away at higher numbers, which is shocking to me personally, and I really worry about my friends and colleagues. We also know that the inability to have family members or other support workers coming in is a critical issue that's impacting those with that live in these group homes or long-term care settings.
Might it be possible to table with the committee the COVID cases that have happened in group residences? You can do so at a later time. And the last question I would ask is, do you have recommendations for group residents in terms of elections? And I'll just with that say thank you to you both and allow Ms. Smith to answer. Ms. Smith, thanks.
For sure. We do know that there are some issues around vouching for people who potentially live in group settings or long-term care homes or other larger settings with vouching. And I brought it up in my introductory remarks. Sometimes people don't have the identification that is required to vote without vouching, and it would really be incredible if that legislation is opened up and that could be allowed for. Just as currently, if you go into a hospital, there's potential to support more than one person is vouched for by a staff member. That would be really great. Thanks.
Thank you.
Thank you, Ms. Smith. Monsieur Thérien, 2.5 minutes, please.
Merci, Madame la Présidente.
Thank you, Madam Chair. Very quickly. What I understand from what you've said, that we need to think together about how we can facilitate the vote during a pandemic, but we have to think about how to facilitate the vote for people like you who have disabilities and to make permanent modifications so that we can facilitate democratic action for all people. So that's what I've understood.
Yes, I would agree with that statement. Thank you.
Merci. Écoutez, je suis d'accord.
Thank you. I also agree with that. I think it's great what you're doing. One thing, Madam Smith, you spoke a lot about the British Columbia model. I would like you to be able to tell us what was done in BC that you thought was good and what could be added to that model so that we could get closer to perfection. I'd like you both to answer.
And Diane had mentioned that the potential to vote by phone, I think, is a really important option. I have heard from a lot of friends who are blind that they took advantage of that, and it was amazing to vote independently. The mail-in ballot was really great to be able to access as a person with an autoimmune condition. Normally I work during elections, but I wasn't able to because it just wasn't safe for me to do so at this time. I think that the longer number of days for voting was really positive. I would say that some things that could be done better in BC, the website wasn't fully accessible. I know Elections Canada does have a much more accessible website, so that's good. And those are the things that I would say.
And if I would agree with everything that Jill has said. I think that the key piece of all of this, again, is making sure that whatever it is that you're doing, that you're talking to and testing it out with individuals with disabilities to make sure that what's being put in place is actually going to work and not just a concept.
And might I just add in that it's not a one size fits all for our community. What I require to have something accessible is not the same as what Diane which is not the same as what, you know, our colleagues who are deaf might need.
Thank you. That was perfect. And now we've got 2.5 minutes with Mr. Blakey.
Thank you very much. And Ms. Smith, I think you've touched on some of these things. Certainly, I think your comments around vouching is an example of this, but I had asked earlier if there were ways of reducing barriers for people living with disabilities that are particularly important right now in the context of the pandemic that would require legislative changes. So beyond the question of vouching, I just wanted to give you an opportunity, because I ran out of time last time, to speak to some of the things you think are really important that ought to be considered in any kind of urgent changes to the Elections Act vis-a-vis the pandemic.
For sure. I really think that having the option to phone in and vote is one of the crucial changes. I know that Diane has ones that she's done specific work on that she could mention, but for me, the ability to easily do a mail-in or a phone-in option to vote, have vouching available, and to also really think about accommodations in rural communities for people with disabilities and the timing of elections. Thank you.
Thank you very much. And Ms. Bergeron, was there anything that you wanted to add on that topic that you didn't have a chance to provide in your last answer?
No, I would agree with Joel. I would say that anything that allows a person to be able to vote without having to leave the safety and security of their own home is going to be key in the upcoming election whenever it happens with COVID. But again, taking the perspective of that and looking at, you know, we need to do things differently now. Let's make it right so that the future is going to be more accessible. The one thing that I do want to impress upon people, and we didn't talk about it earlier, is for people who are deafblind, they really need to have intervener services and assistance with that, and that's currently not provided by Elections Canada. Interpreters for people who are deaf or hard of hearing, they do have that access, but interveners are not provided, and that's key.
Okay, thank you very much.
Mr. Blakey, we've got Mr. Doherty next.
I think it's really Marilyn Gladue playing the role of Todd Doherty.
Okay, sure. Anyway, why not?
Thank you so much to the witnesses for your testimony today. I have a couple of questions. The first one has to do with actually making sure today Elections Canada and federal guidelines say that voting stations have to be accessible. But I had examples in my riding even, and in some of the neighboring ridings, where the buildings that were chosen as polling stations were not accessible. Ms. Smith, have you heard or experienced similar things?
For sure. We know that there are sometimes restrictions in communities where the polling stations that are selected are not accessible. And usually people then receive an alternate spot to vote. And I strongly encourage that all spaces be accessible. They, can help people with disabilities, moms with strollers, aging population, people who have invisible disabilities, if we just are accessible always. But I know that finding the large enough locations is sometimes a challenge, and therefore those are there. I had one suggestion around that at one point is that there would be an easy access line or a chat on the website where people could easily access somebody and say, hey, it's not accessible. I need support right now. Where do I go, or how can I vote?
Excellent suggestion. Ms. Bergeron, how many adult Canadians are blind?
That's a very good question. We say there's about 1.5 million Canadians who are blind or partially sighted. The majority of them would be adults, so it would probably be in the area of at least 1 million, maybe 1.3, somewhere in that area. I don't have the exact number, but yes, there's about 1.5 million.
Okay, and you talked about the phone-in voting. And BC did something in Australia, you mentioned. Were there differences in the way they verified and ID'd the vote?
Yeah, it was a very interesting process. And Jewel, I don't know if Jewel had somebody explain it and did it herself. So the phone-in experience is you don't need to do anything in advance. You just phone in, you talk to someone who identifies you through your various identifications, your social insurance number, your address, your, things that only they would know. And then once you are verified as the individual that is there to vote, they pass you over to another individual who you cast your ballot with. You tell them the vote, they mark it, and then they hand the ballot to a third person who then confirms to you who you voted for. The difference in that process than what I go through when I'm in, on site is the person that is verifying the ballot knows who I am. They know my name, and so the privacy is gone. Whereas this way, the initial person knows who you are, but when they pass you over, that next person has no idea who you are. So they can't, it's still a secret.
And what do you think about the idea of having at the returning office the ability for people that are blind to go in and, be taken to a private place where they can actually say the vote after they're verified?
Yeah, I mean, that would be a great option. Although, like I said, that sight loss is such a spectrum that I'm not sure how everybody is doing the actual marking of their ballot. That could be possible, but again, a lot of those people that working at those stations, at the polling stations, are people who have seen you in the community, because they live in the community, most of them. So, there's an identification. Over the phone, they don't have a clue who you are.
Mm-hmm. And Ms. Smith, one of the things that is sort of a commonality between group homes for people that are disabled and long-term care homes, we're talking about solutions that might work there for elections in a pandemic. And if there was rapid testing available, then the mobile poll idea, where somebody from Elections Canada who has a negative COVID test would then go to the home to facilitate the voting. Do you think that's a good idea?
It's not my area of expertise, and I know you had earlier witnesses. I was listening to them while they were telling you some of the options, and I do think the rapid test is amazing. I think the crossover potential, I really like the suggestion that one of your witnesses earlier had of having a different person that went to each one rather than one person who goes to multiple spaces, again, to just alleviate that potential for infection.
Yeah, no, I think that is absolutely true. What about anything else that you would recommend to this committee? I'll just give you an open-ended, is there something that you wanted to say that you didn't yet have a chance to say?
All the time we have, though, Marilyn, and perhaps they'll be able to somehow squeeze that into the next. Mr. Turnbull.
Thanks, Madam Chair. I'm really grateful to have another opportunity to ask a few more questions. I know Ms. Smith in her opening remarks talked about using the principles of universal design when considering polling stations and just how those would be organized spatially and how they would be much different potentially in a pandemic. I wondered whether those same principles could be used when we look at redesigning the mail-in ballot process, and whether, and I just wonder, I know you've made several suggestions about this already, but I'd just be interested to hear, what that would look like and what that would mean from a timing perspective, a process perspective, how those mail-in ballots can be streamlined. We've heard from quite a few witnesses that they're not very easy to use right now, and I think there needs to be improvement there. So without anticipating your response, I'd love to hear your suggestions on that, Ms. Smith, and I'd be happy to hear from Ms. Bergeron as well.
Sure. I really I like the option that was mentioned by Diane of having the fillable PDF that is printable. I think that helps with a lot of the challenges experienced. I personally have dyslexia, and sometimes fonts can be a real issue for me, making sure, and I have a little bit of anxiety. Did I read that right? Did I write that correctly? So I like the idea of the fillable PDFs that you can print and mail in as one option. And I also, again, just nothing about us without us, having them tested ahead by people with various disabilities. Do these work? And what are the difficulties? And then going back and making sure that they're as accessible as possible. Thank you.
Bergeron?
Yeah, so when we were looking at the with Elections Canada, looking at this before, having the PDF is a good solution in that Anybody that's using, whether it's a screen reader, whether it's, as long as it works with, PC and the iOS and different types of screen readers, as long as it's accessible and can be, accessed through braille displays, which, CNIB can certainly help with. It would allow me to read all of the information and check the box independently. It would allow me to check to make sure that I chose the right, that I've marked it properly. And then if you leave it enough space at the bottom, one of the big things that, as a person with sight loss, it's always kind of makes me a little bit upset is when I have to fill in, I have to sign the document on the line, but the line is not tactile. So either a tactile line or just signing at the bottom of the page, where anywhere on the bottom of the page would be helpful. So things like that is, there are simple solutions. And if they're there, it's not going to work for everybody, but it's certainly going to give a much better option for some of us that would be able to access that option.
Yeah, thank you for
Thank you,
those.
Ms. Bergeron. Thank you. That's all the time we unfortunately have. I know that it's been a very interesting panel, and we really do, on behalf of the whole committee and all the members, appreciate your presence here today, Ms. Bergeron and Ms. Smith. And so that's our third panel. We had, I think, a productive meeting with 3 panels. Just wanted to let you know that November 17th, we've got the meeting with Minister LeBlanc. And then next, we've got Elections Canada on November 19th. And on the 24th, we have the Speaker, House Administration, and PPS. So we have a lot of work ahead of us. And then we're going to continue with the meetings on the study after that. We weren't able to squeeze in a meeting on the 18th in the evening. We were trying to get the extra time slot, which originally we were told we would be able to secure, but then turned out that a lot of the committees are now also receiving 2 time slots a week rather than 1, and so we weren't able to secure that. So I'll do my best to fit in everything and try to get this study done as quickly as possible. I did have a conversation with the Chief Electoral Officer again, and I just wanted to inform you that he is really eager to have some insight as to the 3 recommendations that he had made to the House, and wants to know whether we can get some feedback to him on that as soon as possible, because they want to be prepared in all circumstances, and that would be helpful to him. So he wanted me to let you know. And that's it for today. So we will meet again on November 17th. I will see you all then. Take care.